times.
Thank you, Governor.
Thank you.
And if I could add, if there is, I imagine what the Lieutenant Governor was saying is that our website is probably being overwhelmed by the traffic right now. If the media could help us, it's very simple. It's just extending what we've already been doing, but we'll get this to you. And if you could help us start to translate this in as many ways as possible, that would be helpful. Thank you.
Governor Jeff Reddick from ABC 6 News again, and your communications chief here has asked me to notify you this is the last question, so no pressure. But as you know, there are certain things that an order cannot stop in Ohio, one of those being the weather. Central Ohio was just recently impacted by some severe flooding and some catastrophic damage. Do you anticipate any declaration of emergency additionally for that damage? And to that end, there are a lot of contractors going into homes now for estimates and repairs. Will that be affected by the stay-at-home order?
No, this should not be. I mean, essential services and work that needs to be done, plumbing, electric, things like that. And as far as whether we issue that order, I don't have all the facts in yet, but we certainly will advise you. Let me, in conclusion, just a couple things. I am, as I've told people, I'm an optimist. My wife Fran says anybody with 8 kids by definition is an optimist, but I'm an optimist. And we're going to get through this. We're going to make it. Ohioans are doing what they have to do. Ohioans are out there. We're going to get through this. I'm reminded of a quote from Abraham Lincoln, and if I could just read it. Lincoln said, "I'm a firm believer in the people. If given the truth, they can be depended upon to meet any national crisis." And that's the way I feel about the people of the state of Ohio. Dr. Acton and I and the Lieutenant Governor every day at 2 o'clock have tried to tell you what we know. And when we know it, we've tried to tell you the truth as we are seeing that truth and the facts that we know. I'm optimistic that Ohioans will do what they have to do in the next few days. These are, in fact, crucial days. As I said, I'm an optimist. I think I got my optimism from my father. Fran and I yesterday noticed around our house the daffodils were starting to come out. And when I see the daffodils, I think of my dad. My dad it was 2008. He was dying of pancreatic cancer. Had to know he was dying. It was the fall of that year, and he's someone who throughout his life had planted trees, just as both of my grandfathers had done, even into their late years. And my father insisted that fall that daffodils be planted again. And I know that he had to know that he would not see them. But he had confidence in the future. He had confidence that his kids and his grandkids would see those daffodils, see them keep coming up year after year. So I'm optimistic. The daffodils and other things you're seeing starting to come up remind us of spring, remind us of rebirth, remind us of hope. Optimism that there is a future out there. And we're going to get through this. We're going to get through this. We're a tough people. We're resilient. I've seen it time and time again, whether it's in floods or tornadoes, and I've seen neighbors out there helping neighbors and people picking stuff up and people feeding other people. So we're all in this together in a unique way. What each one of us does determines the future of everybody else. And so we're in this boat together, but I'm confident that we're going to make it. I'm confident we're going to do what we have to do, slow this thing down. We need to sort of get angry at it because it is the enemy. It's the enemy. And I've likened this to a war. I know some people may think that's strange, but this is a war. We've been invaded. It's a silent invader. You don't see it until someone gets sick, but it's an invader. And it depends upon us, frankly, to help it. No time to be helping the enemy. No time to do that. It's time for all of us to do what we have to do. So, and this time during the week that spring started, our daughter Jill's birthday on what usually is the first day of spring or the first full day of spring, the 21st of this month. This is a time for optimism. We can do it, and let's stick together. Let's get it done. We'll see you all tomorrow at 2 o'clock. Thank you.
All right, so we were listening to the Ohio governor there. We are live for you on coronavirusnow.com. We are just about an hour away from President Trump speaking once again for his daily White House Corona Task Force White House meeting. That will be happening in less than an hour. We'll have that live feed here for you. Let's go out live right now to New York City, where we have the mayor, Bill de Blasio, giving a briefing right now. This is all live here on Worldwide News Now.
Exercise, we're not saying you can linger. We're not saying you can make a day of it. We're saying go out, get a minimum amount of exercise, get what you need, and then get back indoors. Same with grocery shopping. Go get what you need, get back inside. The guy go to the pharmacy, get what you need, get back inside. We will be enforcing this, but with understanding for the challenges that people are facing, for how new this is. And I'll talk about it, and then Commissioner Shea will talk about it. We'll enforce through education. We'll enforce through warnings. We'll enforce with having real conversations with people to help them understand what's going on. We're not going to be draconian. We're going to give people a chance to get used to this. But I guarantee you we will enforce this new reality. And I think the vast majority of New Yorkers will understand quickly and will act accordingly. So, folks will go to their parks. That's normal. You want to get outside for a little bit. You want to get some exercise. You want to go for a run. Whatever it is, that's normal. You got to socially distance. You can't do it the way you used to. You can't play team sports at this point. It's going to be, unfortunately, quite a while before that's possible again. There's no more gatherings. There's no more events. There's no more big barbecues. All that is gone for now. It's not gone forever. It's gone certainly for weeks, probably for months. At some point, we'll be able to resume a more normal life. But for now, when you go to the park, you're going for your own exercise. Now, you might say, well, wait a minute. What if it's a parent going with their child and they live under the same roof? Of course. If you're already living with someone under the same roof or a couple that lives together, let's be clear, that's a different reality. People who live under the same roof and are already exposed to each other all day long, and this is something the governor and I explicitly discussed, they already have a different reality, and they don't need to distance from each other because they're already in constant contact with each other. So if a mom goes to the playground with her child, obviously she's already in constant contact with that child. That's different than if that child came in contact with a child from another family, or that mom came in contact with a mom from a different family. That's the problem. Let's be clear. Within the family, under one roof, that's one thing. But families mixing, people connecting who are not under the same roof, that's where we're going to see a spread of this disease that we can't have. That's where the social distancing rules come into effect, 6 feet apart. And we all want to be social, but we just can't the way we were. So you can go to the park, but only for a limited period of time. Families can stay together, but don't mix with other families. If you're going on your own, stay on your own, keep 6 feet apart from everyone else. Go, get your exercise, get home. In terms of playgrounds, this is a thorny issue, and I'm saying this as a parent. I used to take my kids to playgrounds around Prospect Park in Brooklyn constantly. I understand a lot about the culture of our playgrounds and the challenges that we deal with in normal times with all the kids who want to be on the playground. Here's what we're going to do for this next week. And I'm only saying this for this next week because we want to try it out. We're going to say to parents, look, here's the reality. If you're going to go on a playground, you have to take full responsibility for the situation. Full personal responsibility. Here are some of the realities. We cannot have overcrowding on a playground. If there are some people already on the playground, it's starting to get so you can't keep 6 feet away from people who are not part of your family, don't go on the playground. If our police, our parks enforcement officers, or other enforcement agents see a playground that's starting to fill up, they're going to clear it out. If you go to the playground, you need to keep your children away from children who are not part of your family. That's your responsibility. We will always do our best with city enforcement, but we can't be everywhere, obviously. You have to take responsibility. If you don't feel you can do it, don't go to the playground. Some parents have said, will the playgrounds be cleaned and sanitized? The answer, just a real blunt New York City answer, is no. They never have been. They can't be in this situation. It would take a Herculean effort every 5 minutes, literally, that we simply can't do. If your kids go to the playground, you might want them to not be on certain types of equipment or any type of equipment. You might say, I don't want to go to the playground. I just want my kids to run around in an open area. You parents have to make that decision. But what we're going to do is have playgrounds open to the maximum extent possible, monitored and enforced, but parents have to make their own choices for this next week as to what they feel is appropriate. I'm trying to give you real, honest warnings. We'll put up signage. We'll constantly reiterate these rules, and we'll see how it goes for a week. If people are responsible about use of the playgrounds, and we believe it's a good outlet for kids who are only going to get a short period of exercise each day, we'll keep them open. If we feel that they're not being handled properly, if we feel that people are taking advantage in the wrong way of the situation or not paying attention to the rules, or it's creating something that's just not supportable, we'll have to, at that point, strongly consider shutting them down. It's not something I want to do. I really don't want to do that. I'm saying that as a parent. So we're going to see how this week goes. And we have agreement with the state of New York that that is the approach we'll take. Tomorrow, I'm going to provide the state with a written plan delineating what I've just told you in broad stroke, and we'll work with the state each step of the way going forward to determine how best to handle the real sense of reality of our parks and playgrounds. But again, NYPD is going to be out there. If they see anything that looks like even the beginning of a gathering, they're going to say, break it up. They're going to say, you got to get your quick exercise individually and get home. The message couldn't be clearer. And Commissioner Shea will give you a sense of what he's experienced in recent days. But I can summarize it. New Yorkers are listening. They are following the guidance they're getting. And when a police officer or other enforcement officer tells them to do something, overwhelmingly, they are doing it. They all understand what time it is. So I think we're going to see that we're going to find a way to make this work. Okay. Very quickly. Let me just note, hold on one second. Oh, this is consistent with this point. To confirm just how much New Yorkers are adhering to rules, I want to give you an example. It's a very striking example for anyone who knows this town and has been here for any amount of your life, especially if you've been here a long time. I think you might find this striking. Yesterday in New York City, we sent out 4 agencies, NYPD, FDNY, Department of Buildings and Sheriff's Office, to continue doing enforcement at bars, restaurants, movie theaters, gyms, any place that we needed to ensure people were not congregating. There were 13,000 inspections yesterday by those agencies, 13,000 inspections, of which in only 11 instances was a violation given. 1 in 1,000, less than 1 in 1,000 cases was it even necessary to give a violation. I think that speaks volumes about what we are dealing with now. A very important topic. There's been a lot of concern about our jail system. I'm going to be giving you constant updates. This is an area of tremendous concern, obviously. Talked about an initial group of inmates who were being reviewed for release. This will be an ongoing situation and a rapid one. I have been working closely with the police commissioner and other officials, and obviously our correction leadership, to determine the proper approach that is humane and responsive to this crisis, but also constantly takes into account, public safety and obviously legal requirements. 23 inmates are being released today from our jail system. Those individuals are over 50 years old and low risk to reoffend. Some others, we're awaiting a response from the state before they can be released. We are now starting immediate work on a group of 200 additional inmates who are being reviewed for release. We will have the update on what number within those 200 will be released. That update will be tomorrow. These are primarily individuals who have limited time remaining on their sentences on Rikers Island. For all those who are concerned about this issue, I'm concerned, the police commissioner is concerned, the health commissioner is concerned, the correction commissioner is concerned. We're all trying to make sense of a very challenging situation in an appropriate way. We are looking at each individual case. And some of the portrayal of the situation, I think, has left out some of the complexity. There are individuals who I think are obvious candidates for appropriate release. There are some other individuals with complex histories that raise other questions. We're going to strike that balance, but we will continually update, continually look at tranche after tranche of inmates for potential release in this crisis. This next group of 200 we will have an answer on by tomorrow. There's a very rigorous effort being made right now in our jail system to keep everyone healthy and safe. There's a lot of resources being applied for the safety of our officers and inmates alike. That effort will continue to intensify. We have updates. I know some of them, I believe, have been announced about changes in testing locations. You can hear later on details from the health commissioner and from our health and hospitals CEO. There's been a closure of the site at Jacoby. We'll explain that when we get to Q&A. Everything is being done specifically related to prioritization. That means ensuring that we get to those individual patients in greatest need, and we do everything we can to use our testing capacity, ease the burden on emergency rooms. Testing has been fully focused on priority needs, structural needs to keep our health system going, to reach those in greatest danger. It will be tightly organized according to that principle, and we can get into detail in the Q&A. Few other points quickly. For our healthcare workers, these are the people, there's so many heroes in this city, and there's so many people depending on, I think we can all agree there is no group of New Yorkers we are depending on more right now than our doctors, our nurses, our lab techs. Every human being who works in our healthcare system is precious right now. These folks are doing heroic work. They're working exceedingly long hours. They are putting themselves at risk. We must support them in every way we can. A small but helpful thing we can do right now. In light of the profound changes in this city, the fact that so much of the city is not operating the way it normally does, and the idea of commuting has been fundamentally changed, and so many parts of our city are not seeing the kind of traffic, et cetera, that we're used to. We're going to do something temporarily in this crisis and grant parking permits to healthcare workers who we need to serve this city in this crisis. So there'll be a process to determine who qualifies, and we will begin with 10,000 permits for these heroic workers that we will start to distribute as early as tomorrow. Related to how people get around, there's an excellent question in the last day or two on what is essential in terms of how people deal with this crisis. And the question that was asked to me is, if car repair, mechanic shops, automotive shops are being kept open, shouldn't bike repair shops be kept open? I thought it was a very good question. We in the city have compared notes with the state, and we have agreement that, yes, bike repair shops are essential at this time of crisis because more and more people are depending on their bicycles. So, yes, we will instruct that bike repair shops will be treated as essential, and if they are open, all of our enforcement agents will know to respect that and allow them to keep doing their work that we all need. Finally, before I give you a few words in Spanish, just to say, I don't think anyone will be surprised to know that since we're in a crisis, we really have to be careful for everything we need, everything that's a basic need, and nothing is more basic when it comes to protecting people's health care than ensuring that there is a blood supply to serve all New Yorkers. Right now, our blood supply is sufficient, But a lot of the blood drives that happen throughout the year, particularly based in companies that we appreciate deeply, a lot of those have been canceled because the companies have had to shut down. Giving blood is essential, so we need New Yorkers to step forward. Go to any New York Blood Center site in the city. If you are going to give blood, everyone will know that that is an essential activity. Again, you go, you participate, every one of us says thank you, and then get back home, as with everything else. If you are ready and willing and able to give blood, please call 800-933-2566. Again, 800-933-2566, or go to www.nybc.org, nybc.org. Everyone, I've heard from so many New Yorkers who want to do something, who are looking to be helpful and, are frustrated by this crisis and want to help. Here is a way that anyone who qualifies can help, so we really, really appreciate that. In Spanish, comenzando esta noche, solo los negocios esenciales estarán abiertos en la ciudad de Nueva York. Les insistimos a todos, quédense en casa, a menos que tenga que salir por razón esencial, y protejan a los más vulnerables. Los meses que vienen van a ser difíciles, pero vamos a superar esta crisis, como siempre lo hacen los neoyorquinos. With that, I want to turn to our police commissioner. I want to thank you, Commissioner, and all the men and women of the NYPD for absolutely outstanding work in this crisis. And I know together we're going to be figuring out how to do some new things, but I know you are up to the task, as are the men and women who serve under your command. Commissioner Dermot Shea.
Thank you, Mr. Mayor. As the mayor said, it's been an interesting couple weeks here, but I can tell you definitively that the men and women of the New York City Police Department, as well as all the other city agencies, certainly the healthcare workers across the board, are rising to the challenge. And it's at a time like this when, quite frankly, you see the best in people come out. And we're seeing it day in and day out. The traditional crime that we put on the shoulders of the men and women of the New York City Police Department has not been forgotten, but there is so much more that they've picked up in the last couple of weeks. Just most recently, in the last couple of days, we've begun surveying over 500 large supermarkets in New York City. Just yesterday, in the last 24 hours, between pharmacies and supermarkets, over 1,600 visits by the men and women of the New York City Police Department, and literally no issues. A couple discussions about overcrowding, but overall very well. In the last 24 hours, over 5,500 bars and restaurants, and that's the story that you're continuing to see, cooperation by New Yorkers. 2 arrests out of 5,500, and that, I believe, is 1 incident in Queens. So by and large, we are seeing cooperation. We're seeing New Yorkers rise to the challenge throughout the city in all 5 boroughs. You're seeing tasks picked up by the men and women of the police department in reaching out to elderly people that may not be serviced by traditional means, and working with elected officials, working with community partners, getting them food. So I can tell you that I couldn't be more proud of what I've seen. To the parks, the mayor mentioned the parks, and in the last couple days, it's an interesting dynamic now as we get through this time where we've been all stressed, I think, and all pent up inside, and we are like no other city in the world. In a city of over 8 million people, a vertical city. And you saw yesterday people getting out, exercising, which is a good thing. I can tell you that I hit in the last 48 hours, the East River Park, the West Side Highway. I personally saw Riverside Park, Central Park. Over 99% of what I saw is what you hope to see. New Yorkers coming out, parents with kids, responsibly, getting the exercise that the mayor talked about. No, I did not see organized sports. The biggest thing I saw was a 2-on-2 pickup game. And I can tell you that the men and women now of the New York City Police Department are getting more and more involved in this, as the mayor said. I made calls yesterday with some of the borough and bureau commanders of the NYPD to just reinforce that messaging piece of this. We're all in this together. Reinforce that positive message. As much as you want to get out, there's a responsible way to do it. And that's what we all need to hear and take part in. So you'll expect to see police officers throughout the 5 boroughs, whether it's on a bicycle, probably on some scooters and some marked police cars, driving slowly through the parks and just broadcasting and speaking to people about that message. Enjoy, how you doing? Get your exercise, and then politely get out of here. And I say that tongue in cheek. We are all in this together, and it was heartwarming, I'm sure, to see. Mr. Mayor, you touched on it. People that are behind closed doors all day, every day. That's not really what we're worried about when they're walking. A husband and wife holding hands in the park, taking a walk with their dog. That's not really what we're worried about. They're together in the apartment anyway, but it's the large groups. I heard from some elected officials yesterday and throughout the city working on this. We gotta think long distance here. This is a long game. So those backyard parties, those DJs, I'm sorry, DJs, I know how everyone is hurting here, but we can't be having parties with large gatherings, whether it's in backyards or anywhere else in New York City at this time right now. It's just too dangerous. So thank you. I'm sure we'll have some questions, but again, on behalf of all the men and women of the police department, thank you for all the kind words. We are there for you, and we're going to continue to be there for you.
Thank you very, very much, Commissioner. I think you laid it out very, very clearly. I think you said a very nice version of "get out of here." I like that, and we'll make sure the message spreads in a very smart, fair, decent way. With that, want to make sure that we now have an opportunity to take questions from the media on all the things we talk about here and any other topics they would like to bring up. And let's turn to the media questions. Who's first?
Hi, all. Just a quick note at the top. We ask that everyone limit their questions to no more than 2, including follow-ups. This allows us to be fair and try to get to as many people as possible. We will start off today with Aaron from the Post.
Hi, good afternoon, Mr. Mayor. Can you hear me?
Yes, indeed.
Oh, sir, just wanted to circle back on the issue of parks and people going outdoors to get their exercise. And just wanted to see if there's any sort of understanding as far as what the cutoff would be, how much time is enough time, and also understanding that people have been pretty good about abiding by these rules as far as businesses goes, what the sort of potential enforcement or penalties might look like if you encountered anyone particularly obstinate.
I'll start, and I'm sure the Commissioner has a view too. The first thing I want to say is the NYPD, every single day, and I would say this about parks enforcement, and depending on how this plays out, we could easily get other agencies involved as well. But the story that I think is missed, and I don't ever blame the media for telling the exceptional story or the dramatic story, but I would like us all to do a little bit more, particularly in a time of crisis, to acknowledge what is exceptional and dramatic and unusual versus what is typical. When you hear the number of inspections were made and you only had 11 violations, as I mentioned earlier, out of 13,000 inspections, that really says something not just about store owners, but about what people in general are understanding about this crisis. And I have seen it in many places I've been in recent days. I really think there's a deep understanding that something profound has changed and it has to be handled differently. And I have a lot of faith in New Yorkers. I have a lot of faith in everyday people. Will there be some individuals out of 8.6 million people who don't get it? Of course. And our officers, for time immemorial, have had to deal with people who don't get it, people who try and make their own rules, people who think they're smarter than anyone else. I assure you, there's no one more worldly wise than a New York City police officer. There's no one who understands the human condition better than a New York City police officer. And they are extraordinarily resourceful, our officers. So sometimes they use humor, sometimes they use firmness, sometimes they illustrate their point. Whatever it is, I've seen it throughout my life. They know how to talk to people. They know how to talk to young people and old people. They know how to talk to every kind of person. They'll make clear what you got to do, and I believe the vast, vast majority of New Yorkers will listen. We're not to the point yet of specific sanctions because we're starting down a road, and we'll decide with the state if we need to get into sanctions more deeply. But I don't think that's going to be the case. I think the number of people who truly don't get it and try and stand apart is going to be limited. And I affirm, if someone really wants to disagree with a police officer and acts in a manner that's inappropriate and illegal, well, then they will be handled the same way as anyone else who obstructs the work of a police officer. But I don't think we're even talking about the level we might see of that in normal times, because we're dealing with a crisis that's being felt in every inch of our city. I predict you're going to see a different reality in the world will spread. And I'll turn to the Commissioner one more point. How much time? Well, we're going to work on this, and I think it would be helpful if we give people some guidance. But I just want to start with common sense. How much time does it take to exercise? Folks who go for a jog in the morning know how long they go for a jog. People go for a bike ride know how long their bike ride is. People go for a walk know how long their walk is. You know what? If you're exercising now, and you have a basic thing you do, for a lot of people I'd say it's a half hour, 45 minutes, something like that. Go get in your exercise and get home. Or go do your exercise, go to the store, get home. The point is maximize the get home part. Get only the most basic exercise. Understand you need to walk your dog, and then get home. Your kids, understand you have young kids that are going crazy inside. You need to get them outside for a while. Get them outside for a while. As soon as you get them through a little bit of, working off their steam, get them back home. So we'll give some guidelines, but this is also about personal responsibility. This is about common sense, which is what the vast majority of New Yorkers have. We're not going to allow gatherings. We're not going to allow loitering. We're not going to allow someone just to hang out and, for a long period of time. If an officer sees you and you're sitting on a park bench, they're going to say, hey, you need to get home. The person says, oh, I'm only going to be here for a few minutes and I'm going home. Fine. If someone thinks they can hang around for a long period of time, I assure you that officer will remind them again energetically. But people just have to get it. We have to help ourselves and each other by taking seriously, just what you need, nothing more, and get home. Commissioner.
As I hear this discussion, I'm thinking, and I laugh at the reputation that we have as New Yorkers of running around, running from one location to the other, bumping past each other, probably like no other city. I've seen the opposite in the last 2 weeks, and I'm sure you have too, whether it's in parks or walking around. There's a forced politeness these days of allowing one to pass before you proceed down a path. That's what I saw in the parks yesterday, and not universally, but you saw people giving each other that wide berth. In 2 weeks, we've learned to distance, whether it may not always be 6 feet, it may be 3 to 4 feet, but you're seeing this all over. And I saw it yesterday in every park that I visited. Not universally, some issues. We will double down on the education piece. And this, I'll tell you, on a personal level, this hurts. The last thing you want to do is tell kids that are doing everything we want them to ordinarily, but not under these extreme circumstances, get out of a park. But we have to, we'll continue to educate. And again, I think the message here is you can find 3 or 10 or whatever it is messages on Twitter. I was out there myself and saw it firsthand. By and large, there were no large organized sports. There was people getting out on a beautiful day in a really difficult situation. And we'll continue to monitor it. We'll step up the presence as well as the audio messages and the speaking. And again, this is probably the least of my concerns.
I want to just build
Please,
on
Commissioner.
that. I just want to build on that to say, as the mayor mentioned, we want New Yorkers to use good judgment in terms of time, but I want them to pay special attention to ensuring distance. This is about distance. This is not so much about time as it is about distance. And the longer, given the density of our city, the longer someone stays outside, the greater the risk of coming in contact with someone within that 6 feet perimeter. And so that's why focus on distance, not so much on time.
Right, that's great, and I want to just put a point on that, and then we'll keep going. I think Commissioner Barbeau said something that's really good common sense guidance. Yeah, if you stay out longer, your chances of bumping into someone, your chances of being put in a situation that's not the ideal, which is 6 feet apart, those chances increase. Where do you know you're not going to bump into someone or end up coming in contact with someone else who, God forbid, may have the disease? At home, right? It's when you're at home, you know what you're dealing with. So you get the exercise you need, keep it as tight as you can in terms of time. You go to the store. Even if you go to the store, keep your time as tight as possible. Observe that 6-foot distancing. Soon as you're done, get back home, because that's the safe thing to do. And it's not going to be fun. It's not going to be easy, but it's also not going to be forever. And we want to keep people safe. Go ahead.
If I could just one more in that vein, Mr. Mayor. Governor Cuomo this morning floated the ideas of potentially opening up some streets, or I should say closing them to vehicular traffic and opening them up for people who want to get out, stretch their legs, get a little fresh air. Is that anything that's being considered? And thank you all for your time. I appreciate it.
Thank you, Aaron. I spoke to the governor about this, and we had a great conversation, and we're going to codify in the next 24 hours our approach here in New York City, share it with the state, with the governor's team, and we'll take it from there. But we had a high level of agreement in the conversation earlier today. We're certainly going to consider over time the possibility of opening up some streets for recreation, but I want to caution the first frame is the first frame here, which is we want people to get that exercise, get that time they need, but we also need to enforce it. And our ability to enforce directly correlates to knowing where we need to put our focus, our energy, and our officers. We know where that is right now in terms of our parks and playgrounds, because right now the NYPD patrols those areas, the Parks Enforcement patrols those areas. That is something that we can focus on, have a strategy for, and do the right way. If we're going to expand, we're going to expand very purposefully. If we're going to look to have a street that's opened up for recreation, we're going to do that very smartly and carefully, because we have to attach enforcement to it. It cannot be, oh, we're just going to close off some streets and leave it be. If we do that, I guarantee you what will happen is a whole lot of people start to congregate. And again, because we're humans, we're social, it's natural, and people won't remember, and they'll fall into, I see it all the time in the last few days. People start to reach out their hand to shake hands or start to want to hug someone they know, and they stop themselves, almost without exception. I find that sort of sudden stop. It's going to take us a long time to get used to it. So if your block, if you put barriers at the end of your block, everyone's going to come out and hang out like it's normal. We can't have that. We got to do this in a systematic, careful fashion. So that's an idea that's on the table. What I would say is think of it this way. We're going to start with the parks and playgrounds we have that we know how to patrol, determine over the coming days if we need to expand that, and if so, how. But most importantly, how do we enforce it? How do we keep eyes on it? How do we make sure it works? So one stage at a time, and we will keep people updated as we do. Go ahead. Thank you.
Next, we have Alex from the Daily Beast.
Go ahead, Alex.
Hi, can you hear me?
Yep.
Okay, great. There's growing concern among a lot of gig economy workers, not delivery people, but freelancers in general. We've now passed a cycle of a single paycheck, and some people are out of money. If someone is entirely out of money, let's say, and that goes everywhere from rent to food, what actions should they be taking?
It's a very painful situation. I'm glad you raised it, Alex, because this is, I think the gig workers are facing some of the toughest dynamics here. Obviously, it depends on each individual. Anyone who, again, everyone's different, everyone's a different situation. Anyone who does have the opportunity to apply for unemployment insurance obviously should, but we also know that system's overloaded. I'm not belittling that fact. We are hoping and praying that the Congress acts very quickly on a stimulus that is direct money into the pockets of working people, including gig economy workers. Obviously, there have been some other actions taken, which I'm happy about, including by the federal government, like limiting student loan repayments, and actions that have been taken by the city and state to ward off evictions. All of those things help. But we're going to have to do a lot more. And again, the place where we need help the most is the federal government, because the city is, really struggling right now to cover needs with what we have and with our own resources and our revenue that's clearly declining rapidly. So I think it is that stimulus bill, and then it's the things we're going to try and do. That God forbid there's a gig worker who, as you said, hasn't gotten that paycheck, is starting to struggle to find food. That's exactly why Catherine Garcia has been named to this new position, to create a food network, a food distribution network, to help people who, honestly, maybe a few weeks ago, never in a million years would have thought of needing food and government support like that, but now they will. So at least with no evictions at this moment, hopefully people can pay the rent on time, but if they can't, they won't be evicted right now, and we're looking to find other ways to provide support and relief to ensure that people don't have money or not forced to pay rent that they just can't afford. Hopefully we can ensure there's a steady supply of food, and that will at least get us a fair amount along the way. And I remind people, in terms of health care, there's going to be people who won't be able to afford medicine. We're going to try and work on that issue too, but anyone who really is dealing with a serious health care issue, thank God for our public hospitals and clinics that will always back people up, regardless of ability to pay.
Thank you. And one more question. It's being reported right now that 2 dorms of 45 people incarcerated at Rikers are refusing to leave their dorms for work duties and meals in protest. And I'm just curious, is there a way that you guys could be possibly speeding up the release and relief of certain prisoners in our jail system?
Yeah, we are absolutely going to move very fast now. We had to work through some legal issues that were complex issues, as I said, involving DAs and the state. We have a clearer template. We were working on this literally past midnight. I was here in City Hall after midnight, still on conference calls with people working this through, because this stuff is very complex. But I am confident now that we have the ability to figure out what that right number is. I don't know the number yet. I want to be real with you and honest with you. And there's some people who clearly we are not going to feel comfortable releasing. But we will steadily increase the number to the point that we believe is appropriate. I cannot confirm the report that you just gave. I've heard that, but I have not heard it in a confirmed manner, so we will get that information clarified. But suffice it to say, over the next few days, those who can be released to the maximum extent possible, we're going to try and do that over the next few days. Go ahead.
Next up, we've got Amanda from Politico.
Go ahead, Amanda. Amanda?
Can you hear me okay?
Yep.
Hi, how are you?
Good.
I have a question for you and Dr. Katz. I was hoping you could circle back to the Jacoby.
Yes, Dr. Katz is not in the room, but through the miracle of technology, I think he can hear us. Dr. Katz, can you hear us? Dr. Katz. Paging Dr. Katz.
He's on.
Is there Dr. House? He's on? He can't respond to me, is that right? But he's talking on the line? Okay.
Amanda, we'll come back to you.
We'll be right back around.
Appreciate it. Thank you.
Who's next?
We have Ashley from the New York Times.
Go ahead, Ashley. Ashley?
Good afternoon.
There you go.
Yeah, I'm here. The question I want to ask is for the police commissioner about exposure, since officers are basically intensifying their role in the corona, in kind of making sure that everybody adheres to the rules. I'm wondering if you can give us raw numbers on people who are infected and out sick due to coronavirus inside the department, and tell us how, if and how the NYPD tracks exposure.
So, yeah, Ashley, at the beginning, I had a little trouble hearing you, but I think I got the whole thing. The most current numbers that I have, and they are moving, is 98 members of the NYPD have tested positive for corona. Of the 98, 70 are on the uniform side, 28 are from the civilian side. It's important to know that in terms of how they contracted it, the belief at this time, with very limited information, obviously, is that it's not necessarily contracted at work. There's some are contracted sick family members. We are New York. So as society contracts this disease, and, so do we. In terms of the testing, the numbers are going up because the testing on the entire city is going up, so that's not unexpected. In terms of sick rate, I'll stay away from exact numbers, but I can tell you that our normal, if you have a normal sick rate, and we do, for the department, it's approaching about double that rate, and we saw the numbers start to go up when this really took hold, roughly March 17th. I could tell you that we are still what I would consider in very good shape in terms of resources, but we plan for it literally every day. If I told you how many phone conferences I had in the last 24 hours, I'd be lying, because Terry Monahan is sick of hearing from me, Rodney Harrison, the entire executive staff.
Let's be clear, Terry Monahan is not sick, he's just sick of hearing from
Yes, that's good. So we are not at the point where we're close to going to 12-hour tours. What we are doing, though, is planning for all eventualities and moving people from units that are less important right now to, be ready for any and all eventualities. So I think that we are in a good place still, and the planning is literally ongoing hour by hour.
The other thing before Ashley follows on, I just want to say is, again, as we've heard from Dr. Barbeau, a typical younger, and this is, again, most PD officers, younger person,
Healthy.
20s, 30s, 40s, healthy person, their experience with this disease will be something like 7 to 10 days, and it will not be a fun 7 to 10 days, but at the end of that 7 to 10 days, they will be right back in uniform, right back at their post. So this is a number that goes up, but will have an element that starts to go right back down from that original group that got sick. A lot of them will come back online. We'll be going through this for weeks and months. I don't want any misimpression that a person who contracts coronavirus is, not coming back to work. They are coming back to work in the vast majority of cases, and soon. And we got to keep that in our calculations and in our planning. And obviously, we're very happy that most people are going to have a mild experience.
Yeah, I could tell you, Ashley, and if I miss one point, I'll circle back to you at the end. I could tell you that we've had people come back to work that had been put on quarantine, and I am really looking forward to when those people that are out sick with this virus come back to work for the obvious reasons. But I think, again, we're in good shape. Of the now 98, I think there's 3 that remain hospitalized. And that's including one that was discharged today, so that brings it to 3, and that's with pneumonia-like symptoms. I think I mentioned that the other day. So the vast majority, 95 of 98, are recovering at home.
But for those officers who've had contacts with the public, is the NYPD tracking that, and are you telling members of the public that they've had contact with an officer who has now been confirmed to have COVID?
You're talking post?
Once the officer tests positive, are you going back and telling members of the public who they've interacted with in the course of doing their job that they have interacted with them? Do you have numbers on that?
No, I don't, and we'll take a look at that with legal. Obviously, you run into some HIPAA issues and things of that nature.
I go beyond it, and I'll pass to Commissioner. I think we are at such an advanced stage in this crisis. But for a very particular situation where we thought, where our health people thought it was important to do that follow-through, I think the honest truth, Ashley, is we're in a new reality here where that generally is not going to be doable, nor is it necessarily going to make much sense. And I think the Commissioner is going to follow this on because of the sheer spread that we're experiencing overall.
Right. As I've been saying for the past couple of days, which feels like the past couple of weeks, we do have widespread community transmission. So that means that it's very likely that a large number of people are already exposed, and there is no real way to track down back to the point source. The other thing I want to just emphasize is that even though we are learning more and more about how this virus is transmitted, we still don't think that just casual contact, passing someone in the street, is going to infect folks, right? We're asking people to remain 6 feet apart because that's the general distance that a good, healthy, strong cough or sneeze has to get from one person to the other. And so I just want to remind us of the basics, and it's not just passing someone in the street. It's not even limited contact. It goes back to those basics. And so while the tendency may be to want to let everybody know who it is that they may have contacts with, that may have had contact with yet another contact, that kind of becomes irrelevant when we've got widespread community transmission. And that's why I have been so, dare I say, militant about having New Yorkers stay indoors.
Amen. Okay, who's up?
Dr. Katz's issues have been resolved. Dr. Katz, can you hear us?
Yeah, sorry, I could hear you always, but I had a technical problem.
All right.
Thanks so much for the question. With Jacoby, we switched...
Wait, is Amanda, hold on, is Amanda back on the line? I'm sorry, Dr. Katz, is Amanda back?
Yes.
Okay. Yes?
Amanda, we changed the method of testing from more of a walk-by or drive-by model at Jacoby. It will reopen tomorrow to relieve the emergency department, which is consistent with what the mayor says, that we need to focus our testing on those people who are most sick and help to decompress the emergency rooms where people are coming with mild symptoms. We need to focus our attention on those people who are sickest.
Dr. Katz, I'm hoping you're feeling okay and getting some sleep. Is this transition going to happen across all health and hospitals facilities, or are we starting at Jacoby?
Thank you, Amanda. All of our hospitals will have a tent outside as a way to decompress our emergency rooms. Several of them already have it. I visited the tent that was at Elmhurst and the tent that was already at Lincoln. Jacoby had the other model, and that's changing to the tent outside of the emergency room for this week coming.
Okay, great. Thank you very much.
Thank you.
Thank you. We have Craig from the Post.
How are you today? The unions have been calling for additional testing for fire, EMS, and NYPD. I was wondering, since these are the guys on the front line, they're going and they're getting people out of parks, is there going to be any plan to maybe do expedited testing for them if they're concerned that they have coronavirus, since they're out in the streets?
I'll start, and my colleagues will join in. Again, the entire testing system is based on the priority needs. There's a priority given, of course, to protecting our healthcare workers and our first responders, but that's done still according to the healthcare priorities overall. If someone is young and healthy and has symptoms, there's in many, many cases where they're just going to ride it out and they're going to be well and they're going to come back. If after those 3 or 4 days we're not seeing them get better, that's a different discussion. But it's about a priority structure that we have to remember that the testing has to be there to protect the people in greatest danger. You want to speak to that, Commissioner?
Certainly. I think to the extent that they fall into the prioritization categories of being over 50, having one of the chronic underlying illnesses, being sick, not getting better, and having their doctor determine that knowing the test status is going to change the course of therapy, then of course we would want to test them. But the basic message of if you're sick, stay home for at least 7 days since your symptom onset, or 3 days after your fever has gone away, whichever is longer, will continue to apply.
Okay. Who's next?
Next, we have Katie.
Hi, can you hear me?
Sorry. Who is it?
Mayor, can you hear me, Mayor?
Yep. Go ahead, Katie. How you doing?
I'm great. How are you? I'm calling to ask if the city's discussed if there might be any changes to property taxes, which are due in April.
At this point, and we'll obviously be looking at everything, Katie, but we are in a really tough situation right now in this city, and I need to be very plain with New Yorkers about this. In the Congress as we speak, there is a real discussion going on. This is directly responsive to your question. There's a real discussion going on about relief for states, counties, and cities, direct relief, to the tune of hundreds of billions of dollars. Because right now, all local governments are just hemorrhaging money and dealing with massive new challenges and plummeting revenue. An example, I believe this estimate is right from our OMB. When the president canceled or postponed, I should say, income tax payments, that immediately took about $1.7 billion of revenue away from New York City at the height of the coronavirus crisis. That's a massive amount of money to have taken out of our hands just when we need it the most. So revenue is being stressed very, very deeply. Expenses are skyrocketing. We have a lot of tough choices ahead. I'll certainly consider all options, but it is not my instinct to take away other forms of revenue because we literally will not be able to pay for basic services. Now, if we get a massive direct federal stimulus, and I know Senator Schumer and Senator Gillibrand have been fighting for that very hard. I spoke to both of them yesterday. If we get that support, if it's really showing up quickly, that will affect our thinking, that will affect the equation. But I've heard in the course of today that unfortunately Republicans in the Senate are trying to remove any form of direct support for cities, states, and counties, which makes no sense in the middle of the biggest national crisis since the Great Depression, and that's going to hurt red states and blue states alike. It makes no sense. We need that support. We need the hundreds of billions for localities and for hospitals, also hundreds of billions, to be able to keep everything going. We have no guarantees of if and when and how that's going to happen. So the answer to your question is certainly I'm not ready to say that today. I don't think that's something we're going to want to do, but we're going to look at everything.
Next up, we have Gersh.
Mr. Mayor? Can
Hello?
you hear me?
Yep.
Yes, Mr. Mayor, can you hear me?
I can.
I promise you no unauthorized dinging today. I've turned off my notifications.
Excellent.
So you mentioned 10,000 new placards for healthcare workers, and as you know, most New Yorkers will completely agree on the need to help essential healthcare workers do their jobs. But doesn't this emergency order actually reveal how completely unnecessary the vast majority of the city's other 150,000 placards are? Because those are, after all, in most cases, just a job perk.
Gersh, it's a fair question, but honestly not a question for today. We've talked plenty of times about the need to change the approach to placards. I believe that it not only needs to be fundamentally changed, it will be as we bring on automated enforcement systems. And we're going to be very quick to take placards away from those who abuse. And I think we're going to have the greatest ability to know that in the next year or so that we've ever had in the history of the city. But right now, that's bluntly a secondary issue. This is about making sure that people who are desperately needed can get where they need to go. They're working very long hours. This is an emergency measure that we need to do. We'll deal with the rest of that when we get back to normalcy.
All right. Thank you, Mr. Mayor.
Thank you.
Next, we have Jeff Mays.
Everyone's well. Mr. Mayor, I wanted to ask, the governor painted a very different picture of what he saw yesterday in New York City when he drove around. He was very frustrated and talked about how there were a lot of people out, a lot of people in the parks, but that's very different than the picture that yourself and the commissioner painted just now. What's the difference there? Why is the governor seeing one thing, but you guys are seeing something different?
Well, look, first of all, people can be in different places at different times, Jeff, and see different things. I think there's a tremendous consistency in the sense that we all are looking for where we think there's a problem or lack of adherence. When we see it, we don't like it, we're going to deal with it, and we all agree that's not most people. In fact, I think the governor's frustration was directed at the few who were being disrespectful of others, not at the vast majority who are following the rules. But again, I spoke to the governor today in detail, and I'm confident that in that conversation we aligned fully. We're going to have a strong enforcement apparatus from the finest law enforcement organization in the world, and I am certain it's going to be very, very effective. And, you know, I think there's going to be a certain amount of pressure from fellow New Yorkers, too. I think the point that you heard from my colleagues about people, like literally, I think you said cutting people a wide berth, and we were talking about the ways people are adjusting and changing. I'm seeing it 100%. Folks used to just walk by each other. They're now like stopping, figuring out who goes first. You know, is there enough room to have your 6 feet? That's only going to deepen. We're about to really feel the change in our lives with this new rule in effect. And so many people home, I think it's going to really jolt people's consciousness. And this is the beginning of the crisis. I've been blunt. It's going to get a lot worse before it gets better. So Governor and I are aligned. And we're going to say to anyone who's not getting the message, we're going to help them get the message. And then, obviously, I believe people will start to fall in line even more deeply.
Just another follow-up. Do you know what's happening to the prisoners that are being released? Are they being monitored, where they're going? Yeah. And then, quickly, have you still been in contact with federal officials? You mentioned earlier this week you have spoken to Dr. Fauci and the Joint Chiefs of Staff, Chairman. Have you had further conversations with federal officials?
Yeah, I just want, I'll answer, Jeff, but I want to, again, in the name of rationing as we do these calls, I think we're saying to people, try and keep it to 2 areas, and please try not to do multiple run-on many topics at once, because I think we want to make sure it's fair to everyone else. I spoke to the Veterans Affairs Secretary yesterday. I am trying to reach Vice President Pence. I am trying to reach the FEMA director. I know my team has spoken to the FEMA director. This will be ongoing. I've spoken to Senator Schumer almost every day. Spoke to Senator Gillibrand yesterday. This will be ongoing. I've spoken to Dr. Fauci a number of times. Again, what I'm looking for is the big answers on what will be delivered to us. On the question of folks who are released from our jail system, there will be monitoring for sure. There will be individualized monitoring and follow-up and supervision. Who's next?
Next up is Marina from AP.
Marina?
Hello. I was wondering about the what the conditions are at the local city hospitals. We're seeing some videos on social media of patients in masks lying on the floor because there are no beds. Is that real?
Mitch, are you on the line still? Dr. Mitch Katz?
I am on the line, sir. Masks lying on the beds? I don't understand that.
We're seeing video of patients we're seeing videos on social media of patients who are wearing masks lying on the floor because there are no beds. Is that real? Is that fake?
You mean the patients that, I'm sorry, Marina, just to clarify, you're saying patients who instead of being in a bed or a stretcher are on the floor?
Yes.
Okay, I have not heard that previously. Mitch, what have you heard?
No, it is not true. There are no sick patients lying on the floor at any of our hospitals.
And if you have details, Marina, we want them. If there's any place where something's not being done right, we want to know about it. There's definitely some real stress now on our public hospitals. I've been very blunt about the fact that the next 10 days are going to get harder and harder, and we desperately need resupply. But we welcome from our colleagues in the media, if you have a specific situation, which might mean, honestly, there's something wrong at a particular place, a particular moment that needs to be addressed by management, please get us those specifics, even if you want to do it confidentially, so we can follow up and help people.
And are you aware of any nursing homes or who are experiencing any sort of a high number of cases like the retirement community on Long Island Are there any plans to test everyone who's working or a resident of a nursing home?
I'll turn to Dr. Barbeau. I mean, the primary regulation of nursing homes is by the state, and obviously there's a lot of division of labor going on right now with so much to do. But Dr. Barbeau does try and stay in regular touch with the state health commissioner, Dr. Zucker. On this question, are you hearing about any particular areas of concern with the city nursing homes?
So we are in close coordination with the state, excuse me, close coordination with the state on nursing homes, and prior to the start of this, the upscale in this outbreak, we had actually sent out a number of surgical masks to the nursing homes in anticipation of increasing cases. And to my knowledge, there aren't any ongoing outbreaks, but again, things are moving very quickly. They're always in flux, and my staff and the state staff are working closely to ensure that we are especially vigilant with nursing homes, long-term care facilities. The governor has restricted access to those facilities, again, trying to minimize the number of individuals who may show up to them who are symptomatic.
Next, we have Mark Morales from CNN.
Hey guys, how you doing?
Good. How you doing?
Good, good. So I had a couple of questions. The first was in regards to the testing centers in Manhattan. Why were they canceled, and what's the status of what FEMA is doing?
So let's see. I want to make sure we're getting the right person on this one. We're not talking about health and hospitals. You're talking about the work that we're now going to be doing with FEMA for testing. Is that right?
Right, and the location that was going to be there in Manhattan.
Right. So I think that Deanne Criswell, I believe, is on the line, our emergency management commissioner. Deanne, do you want to speak to? And Deanne, I want to remind everyone, served. She's done many things in her life: firefighter, Air Force officer, but also served at FEMA. So she's quite familiar with how to coordinate with them. Deanne, can you speak to that situation?
Yes, I absolutely can. So FEMA did provide some testing equipment and personal protective equipment, and we were originally going to set up 5 separate drive-through sites. Right now, in an effort to utilize the limited resources that we have while still expanding the city's overall testing capacity, we are going to be co-locating these testing sites now with our health and hospitals locations so we can maximize their use in those locations while making the best use of some of the personal protective equipment that is in really limited supply.
Yeah, and Mark, I want to emphasize it's so painful to think of the greatest city in the world with the greatest healthcare organizations, the greatest professionals on earth. I mean, we are so blessed, but if you don't have equipment and you don't have supplies, it's a whole different ballgame. And we all know that when we really needed the testing, when it could have been absolutely strategically crucial, we didn't have it. And now we're at a point where we have to treat testing on a priority basis, given this massive community spread. But even that has to now be thought about in terms of the supplies and the equipment needed even just to keep the testing going as much as we want, because the first obligation is to save human lives. And when we're having to wonder, are there going to be enough masks, for example, for medical personnel, first responders, for everyone who's at the front line saving lives, it gets more and more complex by the day, the considerations that all of our healthcare and emergency management professionals are making. With no guarantees of resupply and supplies dwindling constantly. I said originally, I thought the thing we needed to worry about was the first or second week of April. I unfortunately can't say that anymore. Right now, even getting through the month of March is getting harder. Certainly, we expect tremendous difficulties in the first week of April if we don't get resupplied. So everything is changing by the day in our calculations, and it all comes down to if we don't start to change that supply situation, if we don't get the help we deserve, we're going to have to make even more challenging decisions.
The other question I had was in regards to Rikers. it's about those 2 dormitories, about the inmates who are inside who are not going outside of their dormitories, and I think they're refusing meals. What's being done about that? What are the conditions there? And can you give more specifics as to the monitoring process of inmates when they're going to be released?
We'll get you more on the monitoring. We are obviously creating this approach as we go along, but it's based on some of the other work that we do with supervised release, so we'll get you details on that. In terms of the situation on Rikers, we again don't have confirmation of the specifics, so don't want to comment until we do have confirmation. Our job is to protect everyone. There's a lot of extraordinary professionals who provide correctional health on Rikers and other facilities. Obviously, our corrections officers who protect everyone. And we, look, the one positive X factor here is compared to 6 years ago, we literally have half the population in our jail system we had 6 years ago. We used to be around 11,000 plus, and now we're between 5,000 and 5,500. And we do think we'll be in a position very soon to start acting on hundreds of releases. But this is being created very, very urgently, and also in a way we've never had to do before. And so there's a lot being worked through. We'll have more to say on all of that, in the coming hours as we have more detail.
Next, we have Rosa.
Who is it?
Rosa from the city.
Thank you.
Hi, Mr. Mayor. How you doing?
Good.
Good. So I'm hearing from construction workers who don't understand why they're still building luxury condos and offices. They're cramming into an elevator to go up 50 stories to work on a luxury condo right now. And they want to know why the DOB is not shutting down sites, including sites with reported positive cases. Why should construction on these sites, these kind of sites, be continuing? Why aren't you instructing DOB to shut down building on sites like that?
Rosa, we are working within the parameters of the state emergency order. This is something I know, like every other piece of the equation, that's being constantly assessed. And I care about the safety of those construction workers, and I want to be very clear. If any construction worker is sick, they should stay home. If anyone gets sick on the job, they need to get immediately home, or if it's something urgent, of course, to care. But right now, the state guidance, and this is true in California to the best of my understanding, it was certainly true in San Francisco, but the guidance was to continue that work because it is outdoors, because clearly any part of the economy can still allow people to have a livelihood. That's so important as we see so many other people losing their livelihood. And because a lot of what is constructed obviously is crucial to our future. You and I would agree that luxury condos are not the priority in this city. But there's a lot of other things being worked on that are important because we will come out of this crisis and we will be playing the long game, as Commissioner Shea said. So as I understand it, that is the state guidance at this moment, and I believe it is the same in California. But it's something we're going to monitor all the time, and if there's specific sites we don't think are safe for specific reasons, we always retain the right to act on those. If there's any particular site you know of, we want to understand that so we can do follow-up inspections right away.
Yeah, I do, and I've passed them on to DOB, but just to follow up, I understand that the state does not make any differentiation between essential construction that, it supports infrastructure and things that are, like I've referred to, the offices, the condos, I've talked to people who are outfitting corporate offices right now, like that are totally empty, the insides of them. I mean, do you personally think that there should be some differentiation here?
Rosa, I want whatever's going to keep people safe, and I'm also concerned simultaneously, obviously, that anyone who can keep making a living within the parameters of the state pause order, that is still has value. So I am moved by your question to say we need to look at any individual situation that might need to be treated differently, and I certainly think it's a very important conversation for us to have with the state about whether we want to think about differentiation by type of construction. But I'm not offering personal opinions in the middle of a crisis. I'm hearing your question. I think it's a fair question. Best way for us to handle this is to have a real conversation with the state and get us all aligned on how we want to handle this for this coming week. But Rose, I'll say to you and all your colleagues, any rule, any approach, could change by the week, by the day, depending on changing conditions.
Next, we have Shant from the Daily News.
Yeah, thanks for taking my question, Mayor. I just wanted to go back to the possibility of closing some streets to vehicular traffic. Are there any details under consideration at this time, like the number of blocks or which parts of the city would be involved, that you can share at this time?
I think some people, I believe Speaker Johnson's one of them, have said, look at the model from the Summer Streets program and, consider that as an option. I think that's a helpful example of something to look at. But I want to emphasize, Sean, we are not acting yet on that. I wish I could describe to you what we are all doing in terms of the day-to-day, hour-to-hour, constant decision-making, constant adjustment. It feels like our lives are one endless conference call these last days. But I say that only to say this point. We are constantly making changes and updates. So what I'm being blunt about is, here's how we're starting this coming week. We're starting this coming week with a focus on parks and playgrounds. That's where you go, and streets are open as normal. We're going to see how that goes. We're going to see how enforcement goes. We're going to see how many people come out and how they handle it. If we think it's smart to open up some alternatives, we're only going to do that when we have a clear plan and we have clear enforcement in place. The last thing I want to do is create new places for people to congregate with no enforcement. That would be absolutely contradictory to the state order. So one thing at a time. We do not have a specific plan for those streets yet. I want to affirm that. There is no specific plan. There is no order that's been given, but we are going to consider it.
Got it. And just briefly, can you say who is kind of scrutinizing everything right now? I take it it's your office, DOT. Is the city council involved? Can you say who the players are?
Yeah, I mean, since all of this is kind of run and gun, obviously, because we're dealing with an ever-changing crisis, we're going to work with the city council. They've had a lot of good ideas. We want to hear with them, and they understand their communities. We're going to work with DOT, of course. I think Parks obviously has a lot to say, but I'm going to really say Health Commissioner and Police Commissioner are going to be the first stops on that discussion, because why would we open those streets? Only if we thought it would not endanger people, obviously, so we have to solve for the negative first. If we think opening up more, or I should say closing off streets and opening up those spaces for recreation would create danger, we're not going to do it. Plain and simple. We're not going to do it if we think it's going to be a net negative. If we think it might be a positive, we still need an enforcement mechanism. So that's how we're going to start the discussion. You've heard some of the others who'll be in it, but I am emphasizing, I want to be crystal clear, not happening unless I say it's happening, and we're going to be working closely with the state to align strategies. So I want to be really careful in a crisis that an idea is out there. If an idea is out there that I think is absolutely unworkable, I'll say, period, we're not doing that. Or we're not doing that, in the foreseeable future. If an idea is a good and interesting idea like this one, I'll say we're going to consider it. But I don't want people turning "we'll consider it" into, oh, this is definitely going to happen, because a lot of stuff's not going to happen in this kind of environment. Or we may like an idea, but may turn out to be not workable, where we have really sharp health and safety imperatives that we have to meet. So definitely will be considered. Stay tuned, but not happening now.
Next up, we have Shayna from the Washington Post.
Hi. So recognizing that the strategy is to provide tests on a priority basis, has there been thought to testing frontline city workers, NYPD, FDNY, also, I guess, private EMS, who are non-symptomatic, with the idea that you could take them out of circulation and avoid spreading the virus throughout their ranks?
I think, again, I suspect what the commissioner is about to say is community spread. And again, the whole reorientation we've had to go through with a changing reality with how pervasive this disease is becoming. But Commissioner Barbeau.
Right, so the recommendation would be the same. We're not going to be testing asymptomatic individuals, individuals who are symptomatic. We want to make sure that they take themselves out of excuse me, out of circulation as quickly as possible. The reality is that the best way to avoid propagating the illness is to ensure that symptomatic individuals stay home, limit their outside contact to only the most essential activities. If they have someone who can go out for them to get food, medicine, etc., that's the best thing. Reminding individuals that 80% of the folks who do develop symptoms will have mild symptoms, and that usually within about 7 to 10 days, those symptoms will resolve. We want people to then come back to work 7 days after onset of symptoms, 3 days after their fever has gone, whichever is longest. But the most important thing is for symptomatic individuals to stay out of circulation, whether or not they are first responders, because the reality is that when we've got widespread community transmission, it's implicit that anybody you can come in contact with who is not one of your household members, you have to assume that they are symptomatic, and that's why we want to make sure that people stay at least 6 feet apart.
Shana, I'd also say, we're still in a situation of tremendous scarcity with testing. If that situation changed profoundly, we'd look at, again, I don't think it'll ever have the same strategic impact it would have, a month or more ago. But I think it's a common sense point, and Commissioner can speak to this, that, if you had endless testing capacity, you still have the challenge that negative today could be a positive tomorrow. And I think the symptoms, at least I believe, Commissioner, this is what our healthcare leadership believe, since the jury's still out on asymptomatic transfer, the symptomatic people are the folks that we know for sure there's a concern, much greater likelihood of spread. And that is dispositive. If someone's symptomatic, they're symptomatic. I mean, that's something we know tangibly in a way that even testing might not give us the clearest picture. I'm trying as a layman.
Right. No, I think that's a good point. I think for the foreseeable future, I don't see a scenario where we get real-time results back. And so any delay in someone taking themselves out of circulation then unnecessarily exposes other individuals to potentially contracting the illness.
Whereas symptoms are visible and immediate, and you know what you're dealing with. It's
Yep.
kind of common sense. Go ahead.
Next, we have Sydney from Gothamist.
Hey, can you guys hear me?
Yep.
Great. Sydney with Gothamist. So just going back to the releasing people from city jails that I know a few people have touched on here, you said that you've identified another 200 that you hope to release. And so I know that the Board of Correction has identified hundreds of people who are older than 50 with underlying health conditions in jail for technical reasons. But 551 of those are in DOC custody, serving a city sentence of 1 year or less, or under 1 year for low-level offenses. And my understanding is that, they've called on you as a mayor to use your executive power to release those people. That's 551. So where are you getting the 200 number from? And could you elaborate a little bit on how many people you hope to be able to release beyond those 200?
Sydney, no. I'm going to be straightforward with you. We do not have a magic number at this point. This is something we've never dealt with before. And Commissioner Shea, First Deputy Mayor Houlihan, his Chief of Staff Freya Reel, Liz Glazer, our Director, Office of Criminal Justice, we're all trying to create a new approach here from scratch. We're all talking rapidly, constantly trying to figure this out. There is not a perfect target number. The Board of Corrections letter gave one interpretation of reality. I respect the board, but I don't think it was the most complete explanation of what's really going on. Within each of those categories, there are real variations and real differences from inmate to inmate in terms of criminal record and other factors. So it's just not bluntly as simple as that letter portrays. The group of 200 is the next pool, if you will, of people we are considering. I am not saying we're going to release X amount or Y amount. I'm saying we have 200 we're looking at right now that we're going to decide by tomorrow, and then it's just going to be constantly rolling. But we have to do, I think it's a very complex equation because we need the right kind of monitoring and supervision. We have to make sure that's there. We need to ensure that people we're releasing, we feel relative comfort, are not likely to reoffend or do serious crimes, because we have to balance all of the factors here, and the health conditions of people, absolutely crucial factor. But there's a deep concern that we not create a situation that we are uncomfortable with in terms of the ability to know what the outcomes will be, because you don't want to create a new problem trying to solve an original problem. And we have to take the public safety elements into account. It's very thorny, but one thing we know is we have to move quickly, and we will.
Okay, and so just to follow up on that, the latest understanding I have is that there are 38 people who tested positive for the virus in city jails. That's a combination of staff and detainees. And so I'm wondering, do you know the extent of the spread that is already existing in city jails? And do you know across which city jails that is? Is it beyond Rikers?
I don't have that in front of me. I don't know if Commissioner Barbeau knows if it's just Rikers or beyond Rikers. I think you've answered the point. Obviously, numerically, we know the number of people who have tested positive, and we know, obviously, as with the whole city, there are going to be some people who have not yet shown symptoms but are positive. But we don't have a perfect model for this. We know it's an urgent matter by definition, just the nature of incarceration. So this is, again, it's a tough equation we have to work through very, very quickly. But we're all working together to get these answers and make decisions quickly, particularly for folks, anyone we think there's a particular medical vulnerability, that will be the front of the line.
We don't have information about whether it's Rikers or beyond, but we can get back to you on that.
Last up for today, we have Yoav.
Hey, Mr. Mayor. I wanted to ask 2 questions about the testing priority. One of them is just based on the number of confirmed cases, the percentage of people under 50 who have been confirmed. It comprises 56% of the confirmations. I'm trying to understand, given the criteria for getting tested, how so many people under 50 would have even been tested at this point, because I thought the initial criteria was being over 50 with preconditions, and now it's largely people who are either hospitalized or might require hospitalizations, if I got that correct. So, yeah, I guess why would so many people under 50 have been tested at this point?
I'll start, and I'll turn to Commissioner Barbeau. Yoav, I think, you've seen it that in the course of the last few weeks, we've been rapidly evolving and changing from a situation where it seems like a very quaint time long ago, but it was only a few weeks ago, where we were still trying to get testing in when it could have had a more strategic impact. And, we would talk about, a handful of cases in a day. I think it's fair to say that the testing prioritization has changed radically over the last days in particular. And remember that a lot of folks early on were getting testing, from different parts of our community without that prioritization. So I think that's part of it. What we're seeing again on the difference between who's been tested versus who's been hospitalized is striking. And obviously who is in most danger in terms of, preserving their lives. The fact that 35% of the hospitalizations are folks over 70, more than 3 times the representation of that group in the population. The fact that we've seen no deaths in people between 0 and, birth, I should say, and 44 years old. It keeps confirming that we need to shift as much of our focus as humanly possible to protecting folks from different parts of our community without that prioritization. So I think that's part of it. What we're seeing again on the difference between who's been tested versus who's been hospitalized is striking. And obviously who is in most danger in terms of, preserving their lives. The fact that 35% of the hospitalizations are folks over 70, more than 3 times the representation of that group in the population. The fact that we've seen no deaths in people between 0 and, birth, I should say, and 44 years old. It keeps confirming that we need to shift as much of our focus as humanly possible to protecting folks who are older and have those pre-existing conditions. Now, I'll say it, and the commissioner will say it better than me. There are people under 50 with pre-existing conditions that we clearly are concerned about, and that's a group of people that obviously there are situations where they absolutely need to be tested. But I think the answer is that where we started, a few weeks ago versus where we are now, it's a much tighter prioritization now, and I think as you see testing levels going forward, they will follow that prioritization more and more.
I think that's right, Mr. Mayor. We, through the course of the changing nature of this outbreak, have been adapting, if you will, to the changes that came down from the CDC in terms of testing recommendations. I think that there are a lot of people who in the early period were getting the message, get tested, get tested. We're trying to change not only provider behavior, but also New Yorker behavior, and having people feel comfortable with the fact that as we are in a greater proportion of people having COVID-19, meaning widespread community transmission, that the importance of being tested goes down ever more unless you are in one of those priority categories. And even though we've said, greater than 50 with those 5 pre-existing conditions, I think the reality is that there are many New Yorkers who may be less than 50 and have those chronic conditions. So I think what we're seeing is a shift in changing behavior between New Yorkers, providers, and the availability of testing. And so my hope is, and we're trying to put measures in place, that over time we will see an increase in testing of older individuals and a decrease in that younger age group. Though certainly it is up to provider discretion if they have patients they feel are not getting better. Because again, we don't want to completely discourage people from getting tested if indeed they are not getting better after 3 or 4 days of being home sick.
Okay, thank you. And just along the same lines real quickly, there was a photo by my colleague, David Goodman, our colleague, I guess I should say, outside of Elmhurst Hospital of people waiting to get tested at the tent. And it looks like there's a good 50 to 80 people out there and standing in line. And this was after the change that focused on testing the folks who are hospitalized or kind of severely ill who might require hospitalization. So I guess my question is, am I to assume that everyone out there, meets that criteria? And if so, I guess I'm just wondering if that is the best method to test people who might be severely ill.
Yoav, let me jump in on that, and then Dr. Katz. It's a very good question. I don't, we're trying our damnedest to take an immense amount of information and make it clear, and sometimes I think we don't fill in the blanks as well as we need to, so I'm glad you raised this. But I think we've said it in press conferences, but not nailed it really as clearly as it needs to be. Priority people, that means, folks who were really worried about their fundamental health and their potential, obviously, of severe ramifications. That's not, generally speaking, folks who are younger and healthier, but folks who could easily end up hospitalized or, God forbid, even in danger for their lives. That's one of the priorities for testing. But the other thing that we've said over recent press conferences is to relieve pressure on emergency rooms appropriately, where people are coming in with specific situations that are worthy and need to be addressed, and we're trying not to let the emergency room be overloaded. We have the folks outside emergency rooms who are turning away folks who do not need to be there at all or diverting them to another location where they should be, but also the testing capacity to protect the emergency room's ability to serve people who need it most. So Mitch will speak to that, but I also want to note to Mitch and to everyone, even in a situation like that where we're trying to make sure we're serving people, if the wrong kind of lines develop, and this is something Dermot and I have spoken about, we understand there will be lines some places in New York City. If folks are waiting to go to a grocery store or pharmacy in some places or to get tested, lines need social distancing. We don't like lines at all. I think Dr. Barbeau does not like any kind of line, but if you have a legitimate line, we need social distancing in the line. And there may be times when PD, for example, says about something, we don't think this is a smart way to do this line, and we want people to go away and come back later. There's different ways we'll deal with it. But for that specific situation, let's presume our friends at Health and Hospitals would be very careful to do line management. Mitch Katz, please explain for that line why folks there are being tested and how that fits with keeping your emergency room going.
Yes, sir. When we opened up the tent, we gave tremendous relief to the emergency department so that they could focus on the sickest patients. Those patients were previously coming forward. And of course, everyone has to be assessed because some people really do need to be emergency care. But the tent has allowed us to have them be mild illness to be assessed in a different place to not take up the emergency room time. I'll add that in that picture your colleague took, you'll notice that the people online are all wearing masks. And we give people who are standing on that line a mask in order to decrease the chance that they will cough or sneeze on anybody else. And of course, it's also much better for them to be online in the outside with the free air than sitting in a waiting room in a closed hospital.
Well said, Dr. Katz. With that, thank you, everyone. I hope we were able to share a lot of helpful information, and we will see you tomorrow. Thank you, everyone.
All right, so that was Mayor Bill de Blasio of New York City giving a very long briefing, talking to a lot of members of the media, even accepting call-ins from people. So you can see that we do have the shot right here. Right now, we are just moments away from the President Trump news conference, along with Vice President Mike Pence and many other leaders of the coronavirus White House Task Force. This is a live event you are watching live right here on coronavirusnow.com and all over the world. We do appreciate that. We're going to keep you in two box until we do see the president. We are now going to see from a little bit earlier Governor Andrew Cuomo of New York. We're going to keep you in that New York state of mind before we get you out live to the White House briefing room.
Continuing to increase. What we're working very hard to do is to keep the rate of increase of the spread of the disease to a level that we can manage it in our hospital system. We have 53,000 hospital beds available. Right now, the curve suggests we could need 110,000 hospital beds, and that is an obvious problem, and that's what we're dealing with. You have the nation's role in this situation. You also have the state's role. This is what they call an emergency management situation, and there are rules for emergency management, who does what. Basically, the state governments, local governments, manage an emergency unless the emergency overwhelms the capacity of the local government. And then the higher level of government takes over. That happens even on the state level. A city will be in charge, a county will be in charge, unless it overwhelms their capacity, and then the state comes in and takes over. The federal government has made a decision to leave the states in charge of deciding quarantine procedures, whether to open, whether to close. That's why you see New York taking certain actions, Illinois taking certain actions, different states taking certain actions, because the federal government thus far has said different situations in different states, let the states decide dependent upon the number of cases they have. And I think that has been right to date. That could change, but it's been right to date. However, the federal government should nationalize medical supply acquisition.
The states simply cannot manage it. This state cannot manage it. States all across the country can't manage it. Certainly the states that are dealing with the highest caseload can't handle it. But you're hearing it all across the country from states. They just can't deal with finding the medical supplies that they need. And that's why I believe the federal government should take over that function of contracting and acquiring all the medical supplies that we need. Currently, when states are doing it, we are competing against other states. In some ways, we're savaging other states. I'm trying to buy masks. I'm competing with California and Illinois and Florida. And that's not the way it should be, frankly. Price gouging is a tremendous problem, and it's only getting worse. There are masks that we were paying 85 cents for. We're now paying $7. Why? Because I'm competing against every other state and in some cases against other countries around the world. Ventilators, which are the most precious piece of equipment for this situation, they range in price from $16,000 to $40,000 each, and New York State needs 30,000 ventilators. This is just an impossible situation to manage. If we don't get the equipment, we can lose lives that we could have otherwise saved if we had the right equipment. The federal government has two options to handle this. Voluntary partnership with companies, where the federal government says to companies, I would appreciate it if you would work with us and do this. And the president has done that, and he seems to have gotten a good response on a voluntary basis. The other way is what's called the Defense Production Act, where the federal government has the legal authority to say to companies, you must produce this now. It is invoking a federal law. It is mandating that private companies do something, but I think it is appropriate. If I had the power, I would do it in New York State because the situation is that critical. I think the federal government should order factories to manufacture masks, gowns, ventilators, the essential medical equipment that's going to make the difference between life and death. It's not hard to make a mask or PPE equipment or a gown, but you need companies to do it. We have apparel companies that can make clothing. Well, then you can make a surgical gown and you can make a mask, but they have to be ordered to do it. If the federal government does it, then they can do it in a very orderly way. They can decide how many they need. They can designate how many each factory should produce, and then they could distribute those goods by need rather than having these states all compete against each other. It would also be less expensive because it would avoid the price gouging that is now happening in this marketplace. I can tell what's happening. I'll contract with a company for 1,000 masks. They'll call back 20 minutes later and say the price just went up because they had a better offer. And I understand that. Other states who are desperate for these goods literally offer more money than we were paying. And it's just a race that's raising prices higher and higher. We even have hospitals competing against other hospitals. If the federal government came in, used the Defense Production Act, you could resolve all of that immediately. Also, we need the product now. We have cries from hospitals around the state. I've spoken to other governors around the country. They have the same situation. They need these materials now. And only the federal government can make that happen. So I believe the federal government should immediately utilize the Defense Production Act, implement it immediately. Let's get those medical supplies running, and let's get them moving as quickly as possible. In terms of federal government funding, they should prioritize the funding. Individuals need money. You're laid off. You're going paycheck to paycheck. We took care of the rent issue here in New York, the mortgage payment, but you have to buy food. You have to buy essentials. And if you haven't worked and you're laid off, you're in trouble. So I think the federal government is exactly right. The president has talked about this. Get funding into the pockets of families that need it to live. Second, money to governments. I'm spending money right now that we don't have. I'm not going to deprive people of medical services, but the economy has stopped. People are not paying their taxes. If you're not paying your taxes, that's a state source of revenue. So funding from the federal government is essential for me. And third, the corporate subsidies that the president is talking about, I think, is also right. But the corporate funding should not be a gift to corporations at the taxpayer's expense. Let's learn from what happened in 2008. I was Attorney General at that time in the state of New York, where we bailed out corporations. They bought back stock. They paid their corporate executives handsomely. They benefited from taxpayer money, and the taxpayers wound up getting none of the profits. The citizens should benefit from the corporate success. If the government takes equity, if the government charges an interest rate, but this time, if the taxpayers are going to bail out these big corporations, make sure the taxpayers share in the success of these corporations. Let's do it right this time. Also, the federal funding, they're working on another coronavirus bill. I was in Washington for 8 years. This should not be the usual sausage making of pork barrel, right? When you do a piece of legislation in Washington, most legislatures, it becomes the expression sausage making. It becomes pork barrel. It goes through the political process. And the political process says everybody should get some money, which dilutes the funding, gives it to communities and governments that don't really need the funding, and doesn't even address the need. It's one of the reasons why people are so suspect of government spending, right? Because it winds up pork barrel. Every senator is going to say, I want money for my state. Every congressperson says, I want money for my local district. I want to be able to go home with a little package that I can hand to my local government. That's not what this is about in this case. This is about addressing a need and getting funding, precious funding, to people in places that need it. And the rule here should be money follows the need. It's that simple. What places need it? Self-serving, but New York State has 15 times more cases than any other state right now. Fund the states, fund the places that need it, follow the number of cases, and use need as the basis for funding. It's common sense. It will be respected by the people of this nation. And the alternative to politicize this funding process is intolerable. To my congressional delegation, I say, look, New York received no funding from the first coronavirus bill, even though New York has the greatest need. And that was a technical mistake in the way they wrote the bill. Political custom is one politician or elected official should not pressure people of their own party. My congressional delegation is largely Democrat. So political custom would be, well, don't pressure another Democratic elected official. I say that is baloney. I represent all the citizens of the state of New York. That is my job. It's a very simple job I have. I fight for New Yorkers, period. Democrats, Republicans, period. And this is no time to play politics. and we need our congressional delegation to stand up and to fight for New York. Also on the federal role, I'm requesting today from the federal government that the Army Corps immediately proceed to erect temporary hospitals. I went out yesterday, I surveyed the sites. There are several good options that give us regional coverage. An Army Corps temporary hospital at Stony Brook, which is on Long Island, Westbury, which is on Long Island, Westchester, where we have that terrible cluster, which is, thank goodness, reducing, and the Javits Center, which is a very large convention center in Manhattan in New York, and New York City is obviously where we have the highest number of cases. I met with the Army Corps. They've reviewed these sites. I approve it. I approve it on behalf of the state of New York, and now we just have to get it done and get it done quickly. These temporary hospitals are helpful, but they don't bring supplies and they don't bring staff. And that compounds our problem of not having enough medical supplies, and frankly compounds our problem of not having enough medical staff because we are trying to increase the capacity in our existing hospitals. The sites that we picked allow for indoor assembly of these facilities, so they won't be out of doors. They'll be indoors. Some places we may need to do them outdoors, but these campuses also have dormitories where the healthcare staff can stay. They're very large, there's space, and again, I have made all necessary approvals, so from my point of view, construction can start tomorrow. These are pictures of the places where we would assemble them in Stony Brook, Old Westbury, Westchester County Center in Westchester, all indoor locations, all open, all ready, accessible. Jacobs Javits Center, we just expanded it. It's one of the largest convention centers in the country. It's open, it is ready to go. There is no red tape on the side of New York. We're also asking FEMA to come in, Federal Emergency Management Agency, to come in and erect 4 federal hospitals at the Javits Center. The federal hospital by FEMA is different than the Army Corps of Engineers temporary facility. The FEMA hospitals come with staff and with supplies. They're in 250 bed configurations. We're asking for 4 of those 250 bed configurations to be assembled in the Javits Center. The Javits Center can easily manage them. It's in the heart of Manhattan. They're fully equipped. They're fully staffed. Again, we are ready to go as soon as the federal government is ready to go. That will then give us regional coverage in downstate New York, which is our most heavily impacted area. The President signed the FEMA emergency declaration, which allows FEMA to go to work. By that emergency declaration, funding for these services is split, 75% by the federal government, 25% by the state government. The federal government can waive the state's share, as they call it, waive the 25% from the state. I'm also requesting that the president waive the 25%. I just cannot pay the 25%. We literally don't have the funding to do it. And by the way, I don't believe any state will be in a position to waive the 25%. So I don't just say that on my behalf, I say that on behalf of all the governors. I'm the vice chairman of the National Governors Association. I've been speaking with governors all across the nation. No state has the financial capacity to participate, in my opinion. But I know for sure New York doesn't, because we are the heaviest hit state right now. I'm asking the president to do what I did here in the state of New York, cut the red tape, cut the bureaucracy, just cut to the chase, get the Army Corps of Engineers moving, get FEMA moving, let's get those buildings up, let's have them in place before that trajectory hits its apex. Time matters, minutes count, and this is literally a matter of life and death. We get these facilities up, we get the supplies, we will save lives. If we don't, we will lose lives. I don't mean to be overly dramatic, but I want to be honest, and that is the simple fact of this matter. We're also implementing the trial drug. We have secured 70,000 hydrochloroquine, 10,000 Zithromax from the federal government. I want to thank the FDA for moving very expeditiously to get us this supply. The president ordered the FDA to move, and the FDA moved. We're going to get this supply, and the trial will start this Tuesday. The president is optimistic about this, about these drugs, and we are all optimistic that it could work. I've spoken with a number of health officials, and there is a good basis to believe that they could work. Some health officials point to Africa, which has a very low infection rate. And there's a theory that because they're taking this anti-malarial drug in Africa, it may actually be one of the reasons why the infection rate is low in Africa. We don't know, but let's find out, and let's find out quickly. And I agree with the president on that, and we're going to start Tuesday. I also think the FDA should start approving serological testing for coronavirus antibodies, and they should do it as soon as possible. What this does is it tests the blood to see if you have antibodies that were created to fight the coronavirus. Remember, all the health officials say the coronavirus was here before we started to test. Many more people have had the coronavirus than we think. Most people have resolved the coronavirus who have had it. How do you know that? You can test and find the antibody that the body created to fight the virus. If you have that antibody, it means you had the virus and you resolved it. Why do you want to know that? Because I want to know who had it, who has the antibody, which means they most probably will not get it again, and that can help us get our medical staff back to work faster. So it's a different level of testing, but I think the FDA should move as expeditiously as they have before on this type of testing. Find out who had it, who has the antibodies, and that will help us, especially on medical staff shortages. Also, on the state role, what am I supposed to do? I'm not just looking to the federal government. I understand that we are responsible here in the state of New York, and we're doing everything we can on hyperspeed. We have to expand the existing hospital capacity. This gets back to the 53,000 current beds when we may need 110,000 beds. We have said to the hospital administrators, we have a goal of you increasing your capacity in each hospital by 100%. Yes, an ambitious goal. Yes, very difficult. Yes, it may be impossible in some places. But remember, a hospital is highly regulated. Space is regulated. The number of beds in a room is highly regulated. We're waiving all those regulations and saying, just from a physical capacity point of view, see if you can increase your capacity 100%. Where do we get 100%? We have 53,000 beds. We have to get to 110,000 beds. Everybody increases by 100%. We meet the goal. Simple. A little too simple, but we understand many hospitals won't be able to do it. However, at a minimum, hospitals must give us a plan to increase capacity by at least 50%. So we would be at about 75,000 minimum against the 110 need. We would still have to find additional beds. I understand that. And you see what we're doing with the federal government. There's an opportunity there. But Every hospital, goal of 100% increase in capacity, mandate of 50% increase in capacity. We also have an intensive care unit bed issue where we have to increase the number of intensive care units. That is limited by the number of ventilators. What makes an ICU bed an ICU bed in this case? It's that the ICU bed has a ventilator. And that's where we get back to needing the ventilators desperately, so we have those ICU beds. We're putting out a Department of Health emergency order to hospitals that says we're not just asking you to do this. It wouldn't just be a nice thing. I'm not just asking you as governor as a civic obligation. This is a law that the hospitals must come up with a plan to increase capacity, a minimum of 50, goal of 100%. We're also canceling all elective, non-critical surgery for hospitals as of Wednesday. Elective, non-critical. If it's a critical surgery, fine. If it's not critical, then postpone it. That alone should get us 25 to 35% more beds. And again, that is a mandate that is going into effect for the hospitals. I understand the hospitals are not happy about it. I've heard that. The elective surgery is a big source of revenue for the hospitals. I understand that, but this is not about money. This is about public health. And we're putting that mandate in place starting today. We're also creating additional beds in places where we can. We're taking over existing residential facilities, hotels, nursing homes, and repurposing existing facilities. For example, this is the Brooklyn Center for Rehabilitation and Healthcare, 600 beds that we're going to take over, and it will serve as a temporary hospital. And we're doing this in facilities all across the state. Two different facts. I want to make sure we're clear just so there's no confusion. Fact one, young people can get the coronavirus. They are wrong when they say they can't get it. They can get it. 18 to 49-year-olds represent 53% of the total cases in New York. This is not China. This is not South Korea on the theory that, well, I'm an American youth and therefore I have a superior immune system than China or South Korea. No, that theory is not correct. In New York, 53% of the cases, 18 to 49 years old. Second fact, older people and those with compromised immune system, underlying illnesses, can die from the coronavirus. You're right, the 18 to 49-year-old is probably not lethal, but you can get it, and you can get sick. And it's a nasty illness, and then you can transfer to someone else. That's the case for young people. Older people, obviously, if you're a vulnerable person, it can be lethal. Both facts are true, and both facts have to be understood. Young people can get it, you will get sick, you probably won't die, but you can transfer it to someone who may very well die. And you can transfer it even inadvertently without knowing you're doing it. You can touch a surface, walk away. A day later, someone can sit at this table and put their hand in the same place and contract the virus. I was in New York City yesterday. It was a pretty day. There is a density level in New York City that is wholly inappropriate. You would think there was nothing going on in parts of New York City. You would think it was just a bright, sunny Saturday. I don't know what I'm saying that people don't get. I'm normally accused of being overly blunt and direct. And I take that. It's true. I don't know what they're not understanding. This is not life as usual. None of this is life as usual. And this kind of density, we talk about social distancing. I was in these parks, you would not know that anything was going on. This is just a mistake. It's a mistake. It's insensitive, it's arrogant, it's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop now. This is not a joke, and I am not kidding. We spoke with the mayor of the city of New York and the Speaker of the City Council, Corey Johnson. I told both of them that this is a problem in New York City. It's especially a problem in New York City parks. New York City must develop an immediate plan to correct this situation. I want a plan that we can review in 24 hours so that we can approve it. There are many options. You have much less traffic in New York City because non-essential workers aren't going to work. Get creative. Open streets to reduce the density. You want to go for a walk? God bless you. You want to go for a run? God bless you. But let's open streets. Let's open space. That's where people should be, in open space areas, not in dense locations. There is no group activity in parks. That is not the point. We spoke about it the other day. All sorts of kids playing basketball yesterday. I play basketball. There's no concept of social distancing while playing basketball. It doesn't exist. You can't stay 6 feet away from a person playing basketball. You can, but then you're a lousy basketball player and you're going to lose. You just cannot do that. We also have bigger parks in New York City. We opened Shirley Chisholm Park in Brooklyn, 400 acres. Van Cortlandt Park. There are big parks. There are big spaces. That's where you want to be. But we need a plan from New York City. I want it in 24 hours because this is a significant problem that has to be corrected. In terms of numbers, I said yesterday New York is testing more people than any state in the country and per capita more than any country on the globe. That is a positive accomplishment, pardon the pun, because we want testing, we want more testing. We ramped up very quickly. We're doing it better than anyone else, and that is a good thing because when you identify a positive, then you can isolate that person, and that's exactly what we're trying to do. When you increase the number of tests, you're going to increase the number of people who test positive. And the numbers show exactly that. We have now tested 61,000 people. Newly tested 15,000 people. So these numbers just are exponential to what is being done anywhere else in the country. And that's why you're going to see much higher numbers than anywhere else. Total number of new cases, 15,000. I'm sorry, total number of cases, 15,000. Total number of new cases, 4,800 new cases. You see the state, more and more counties. We're just down to a handful of counties now where we don't have existing cases. As I said, that is going to be 100% covered. It's just a matter of time. On the hospitalization rate, which is a number that I watch very closely, it's 1,900 cases out of 15,000, 13%. 13% is actually lower than it has been. We've been running at 15%, 16%, as high as 20%. This is 13%. This is the key indicator because this is saying how many people are going to come into your healthcare system as the number goes up. So this is not bad news. Across the country, you see New York now has 15,000 cases, Washington State 1,600, California 1,500. So we have roughly 15 times the number of cases. Now, do we really have 15 times the number of cases? You don't know. We're testing much more than anyone else. So that is a major factor in this. But I have no doubt that we have more cases. We have more density. We have more people from other countries who come to New York than many other states. I have no reason to believe that we don't have more. I don't believe we have 15 times more. I believe that's also a factor that we test more than anyone else. 114 new deaths, total number of deaths, 374. And that is a sobering, sad, and really distressing fact that should give everyone pause, because that's what this is all about, is saving lives, and we've lost 374 New Yorkers. Keeping it all in perspective, Johns Hopkins has followed this from day one, 311,000 cases, 13,000 deaths. Statewide deaths, to the extent we can research the cause of death and the demographics of death, what we're seeing roughly, 70% of those who passed away were 70 years old or older, and the majority had underlying health conditions, okay? So it is what we said it was. Approximately 80% of the deaths of those under 70 years old had an underlying health condition. So, young people can get it, young people will get sick, young people can transfer it. Mortality, lethality, older, compromised immune system, underlying illness. That's what we're seeing. But even within that population, the capacity of our health care system can save those lives. It doesn't mean just because you're 80 and you have a compromised immune system or you have an underlying health condition and you get coronavirus, you must pass away. That's going to depend on how good our healthcare system is. But in terms of overall perspective, I'm afraid for myself, I'm afraid for my sister, I'm afraid for my child. Older, underlying illness, be very, very, very careful. This gets back to Matilda's law. This gets back to my mother. That's my fear. This gets back to nursing homes, senior care facilities, etc. Personal advice, this is not factual. I try to present facts. I try to present everything I know. I try to present unbiased facts. I try to present numbers, because people need information. When do you get anxious? When do you get fearful? When you don't get the information, or you doubt the information, or you think people don't know what they're talking about, or you think you're getting lied to. So I present facts. This is personal advice. This is non-factual. So it's all gratuitous. You can take it, and you can throw it in the pail. But we have to think this situation through. Don't be reactive at this point to this situation. Yes, you are out of control in many ways. You're out of control to this virus. You're out of work. Situations are changing. They're not in your control. You don't even know how long this is going to go on. It's a very frightening feeling. That is true. But you can also take back some control. Start to anticipate and plan what's going to go on. Plan for the negatives and plan for the positives. There are going to be negatives and there are going to be positives. There are real economic consequences. How do you handle the economic consequences? You're not alone. It's everyone in the United States. That's why you see this federal government acting quickly to get funding into the pockets of families who need it. But think through what the economics mean. Think through the social issues and the social impact of this. Think through the emotional issues of this. You know, it would be unnatural if you didn't have a flood of emotions going on. It would be unnatural. Either you wouldn't understand what was happening or you wouldn't appreciate it. But if you know the facts and you understand what's going on, you have to have a flood of individual emotions, positive and negative, and anticipate it. You know, stay home, stay home, stay home. Whether you stay home, remember the old expression, cabin fever, right? You stay home alone, you don't want to be isolated emotionally. You can be isolated physically. You don't want to be isolated emotionally. You want to keep those emotional connections. You want to talk to people. You want to write letters. You want to have emotional connectivity. That is very important. If you're not alone and you're in the house with the family and the kids and everybody's together, that's a different set of emotional complexities. You know, being in that enclosed environment, normally the kids are out, everybody's going to work, and you're only together a short period of time a day. Now you're all in the same place for 24 hours. You know, I remember when the kids were young, what it was like. It was pure joy. But I remember what it was like to be with them for multiple hours. You know, it's complicated. I live alone. I'm even getting annoyed with the dog, you know, being in one place. So think that through, because that is real, and it's going to go on for a period of time. This is not a short-term situation. This is not a long weekend. This is not a week. The timeline, nobody can tell you. It depends on how we handle it. But 40%, up to 80% of the population will wind up getting this virus. All we're trying to do is slow the spread, but it will spread. It is that contagious. Again, that's nothing to panic over. You saw the numbers. Unless you're older with an underlying illness, etc., it's something that you're going to resolve, but it's going to work its way through society. We'll manage that capacity rate, but it is going to be 4 months, 6 months, 9 months. You look at China, once they really change the trajectory, which we have not done yet, 8 months, we're in that range. Nobody has a crystal ball. Nobody can tell you, well, I want to know, I need to know. Nobody can tell you. I've spoken to more people on this issue than 99% of the people in this country. No one can tell you. Not from the superb Dr. Fauci to the World Health Organization to the National Institute of Health, but it is in that range. So start to plan accordingly. It's going to be hard. There is no doubt. I'm not minimizing it. And I don't think you should either. But at the same time, it is going to be okay. We don't want to overreact either, right? The grocery stores are going to function. There's going to be food. The transportation systems are going to function. The pharmacies are going to be open. All essential services will be maintained. There's not going to be chaos. There's not going to be anarchy. Order and function will be maintained. Life is going to go on. Different, but life is going to go on. So there is no reason to be going to grocery stores and hoarding food. You see all this overreaction on the TV every day, which then makes you think, well, maybe I'm missing it. Maybe I should run to the store and buy toilet paper. No. Life is going to go on. The toilet paper is going to be there tomorrow. So a deep breath on all of that. But I do believe that whatever this is, 4 months, 6 months, 9 months, we are going to be the better for it. You know, they talk about the greatest generation, the generation that survived World War II. Dealing with hardship actually makes you stronger. Life on the individual level, on the collective level, on the social level, life is not about avoiding challenges. Challenges are going to come your way. Life is going to knock you on your rear end at one point. Something will happen. And then life becomes about overcoming those challenges. That's what life is about. And that's what this country is about. America is America because we overcome adversity and challenges. That's how we were born. That's what we've done all our life. We overcome challenges. And this is a period of challenge for this generation. And that's what has always made America great. And that's what's going to make this generation great. I believe that to the bottom of my soul. We're going to overcome this, and America will be the greater for it. And my hope is that New York is going to lead the way forward. And together, we will. Questions?
Governor, on New York City reducing its density, is it within your powers to do those sorts of things? And you're talking about closing streets to traffic, to increase pedestrian traffic. Can you explain the logic of what exactly that would look like in New York City?
I could make those decisions in New York City. In truth, Jesse, look, first of all, I'm in New York City, born and bred, if you can't tell. So I know New York City from every kind of dimension. I don't know the situation with the parks well enough, and I don't know the situation on opening streets, closing streets well enough. And frankly, I think the local officials are in a better position to make those decisions. They see this issue also. It's not that they don't see the issue. They see the issue. They see the problem. I want them to come up with a plan. I think they're in a better position to do it. I want to know what it is, and I want to approve it because this is a serious problem. That density has to be reduced, and it has to be reduced fast. And that's why I'm asking for a plan from them in 24 hours. But I think they're in a better position to do it.
Would you imagine closing parks and playgrounds and things like that?
I want to see what they say. They know. They know the problem. They see it. I mean, it's all over the place. It's not that, you need a microscope to find this. It is all over the city. Now, maybe it was a nice day yesterday or whatever, but it was all over the place.
Capital Region are running low on tests and medical supplies. They stopped doing public testing. Some have stopped the drive-through testing. Is that the right thing to do at this point? Are we running low on medical supplies?
Well, Josefa, the main problem is the equipment. It's the gowns, it's the masks, it's the PPE equipment, and we sent 1 million masks to New York City yesterday. We have 1 million masks here, so we can supply hospitals. But we're talking about a very short period of time. We're then scrambling to buy all these masks. I have companies that are manufacturing masks for us. We're buying sewing machines to make masks. But this is not the way it should be done. Let the federal government, they have a law called the Defense Production Act, which is precisely for this. I get the president saying he wanted to work voluntarily with private companies and ask them to help, and I get the president saying the private companies were great and they came forward and they said, we want to help. I get that. I say, forget the voluntary partnership, order the companies to produce it, let the federal government do it, so that the private company doesn't wind up marketing with all these states that are competing. Think about it. We paid 85 cents for a mask. We're now paying $7 for the same mask. Why? Because California will pay $6, and Illinois will pay $6.50, and Florida will pay $6.75. I'm just making up those numbers. But that's not the way it should be. Let the federal government take the function of medical supply production and distribution. Just take it, right? When it came to testing, I said the exact opposite. I said to the president on testing, when everything was going through the FDA and everything was going through the CDC and it was slow, I said to the vice president, decentralize it. Give that function to me, the state. Why? I have 200 laboratories that I regulate. Give it to me, I'll turn on 200 laboratories. Rather than going through a bottleneck in the federal government, everything has to go through the FDA and CDC. So I said in that situation, give me the task. I'll get it done faster. So it's not like I'm trying to say the federal government should do something to take a burden off me. I've accepted the burden of testing from the federal government. And by the way, our numbers went through the roof. This task, they are in a better position to do than I am. Order the production of masks and gowns and ventilators. Give them a deadline. Don't get into this mad bidding war. They know how to distribute it because you look at where the cases are. And distribute it by the need of the cases from Washington. Let them take that. This is the president can do this. Frankly, it's the president's style to say, cut to the chase, this has to be done, and I'm mandating it, and he should do that here.
But to that point, should we now stop publicly testing and only test people who are either in the hospital or in serious condition at this point?
No, I'm not willing to give up the testing because the testing is one of the ways we slow the spread. There's only two ways to slow the spread. Density reduction, which we're all over, and we can't do anything more than that. We're already at 0 on non-essential workers. The second way is testing, find the positive, isolate the positive. So I'm not willing to stop testing because our number one job is slow the trajectory of the increase because I can't handle it in the hospital system.
But if the disease is becoming endemic, what's the point of testing, I guess? You know, if you yourself have said 80% of the population could become infected, at what point, is it a diagnostic test? What is the point of testing?
There is a point of inflection, you're right, where you could hit a point where the disease is so widespread, it's not worth the testing. We're not there yet, Jesse, because we're still trying to stop the apex, right? We have to bring down that curve. Even if we're successful on this health order, where we get the hospitals to go to 50% additional capacity, I'm still at only 75,000 beds when we need 110. I'm still only at 13,000 ICU beds when I need 37,000 ICU beds. I'm still at only 6,000 ventilators when I need 30,000 ventilators. So we have to do everything we can to keep that curve down, and testing is essential to that.
What should police departments be doing to enforce the rules once they go into effect at 8 p.m.? Should police be breaking up groups of people hanging out on the sidewalks or the streets or the parks?
That's what I want to see from New York City. I want New York City, I want the mayor, the city council, Speaker Corey Johnson, let them come up with a plan. Get it to me within 24 hours. I want to approve it, but I'm open to anything. But it has to be done quickly, and it's going to have to be dramatic action. Excuse me one second, because it's not. I can't say anything more than I've said, right? How many times can you say you're being reckless and selfish, and brings out the best, it brings out the worst. We all talk about being a community. We're a community. What does a community mean? We're interconnected. We're interdependent. I rely on you. You rely on me. That's community. That's us at our best, the community of New York. I need to be able to rely on you. And that means you have to be smart and responsible in your actions. And you have to be able to rely on me. And that means I have to be smart and responsible in my actions. And that's the social contract between us. I have a right to expect that from you, especially in dire circumstances. And we're not there, and we should be there. And I'm going to keep saying it, but we're also going to be doing it. And I want the plan from New York City to make that a reality. Sorry, I'm sorry.
The Attorney General today saying that she wants next month's elections to be absentee-only statewide to like avoid people living in places. What do you think about that? Is that something you're discussing?
We are discussing, we have done increased absentee ballots for elections. I think it's a good idea anyway. We should have done it a long time ago. It's especially a good idea when you don't want a lot of people going to a polling place. Melissa was handling that issue.
Sure. Article 2, Section 2 of the Constitution says that there are only two ways that you can vote absentee. One is if you're sick, and the other is if you're unable to go to the poll. Over time, the legislature has legislated what it means unable to go to the poll as being out of county. And so what we're looking at is if our executive authority will allow us to overcome that, or if we have to talk to the legislature about changing the law to allow for it.
Okay, so you don't know whether yet you have the power to actually say suspend all voting in person.
Exactly, that's what we're reviewing right now.
Are there any new steps for nursing homes that have been, that the state's looking at? We're seeing, some deaths at a retirement community.
No, we've done everything we can. They are the vulnerable area, right, because they're a congregation of the vulnerable population. We said no visitors, which is really dramatic and sad action, right? You're in a nursing home, you're alone, you look forward to family visiting, and then we say no family visitors. We're encouraging and working with the nursing homes for telecommunications and Skype and FaceTime and all that. But nothing new.
No plans to test all the workers there, the residents?
Yes, we have those regulations that before the staff comes in, they have to be tested.
Governor, I need to circle back on your comments regarding time matters, minutes count, this is a matter of life or death. How are you telling hospital staffers and hospitals in general to prepare while we wait to see whether the federal government hears your call to action? How are you telling them to prepare right now based on what you've described to us?
You got two separate tracks. It's a good question. Two separate tracks. One, state action. Assume no one else does anything but you, right? And I operate on that track. Assume the federal government doesn't do anything. And it's just New York State and New York State alone. And we're going down that track, and I'm doing everything possible on every level to do just that. And that's increasing the hospital capacity, minimum 50%, goal of 100%. They have to come up with a staffing plan to do that. That's finding the medical supplies for them. I'm not stopping on the medical supplies. We're manufacturing masks. I'm talking to uniform manufacturers to get them sewing machines to convert. I have apparel companies that manufacture in China to stop making dresses, to start making gowns. I mean, we're doing every kind of thing we can do. Child care facilities for healthcare workers, special protections for healthcare workers. Assume the federal government does nothing. And we have that plan in place. At the same time, I am saying to the federal government, you need to do what you need to do. There is a federal role here. And this emergency management protocol, well, we support the states. Yeah, you support the states if the states can do it. That's what the emergency management protocol is. I do this as a governor. There's a flood in Erie County. Okay, Erie County, you're in charge. Call me if you need something. Yeah, I get that. But if I know the flood can't be handled by Erie County, then I come in, and I'm the governor. And I come in and I say to the county executive, we're here, I'm the governor, I'm going to bring state resources. I'm saying to the federal government, and I'm saying to the president, you should take over the medical supply function. Invoke fully the Federal Defense Production Act, order manufacturing companies to manufacture it. Every state is saying, every city is saying they're running out of medical supplies. Do that. B, get FEMA, get the Army Corps of Engineers. You have the sites. Tell them to come up here tomorrow and start building those emergency hospitals. C, pass the funding. Don't let the Congress make it pork barrel. Don't let them make it political patronage where everybody brings home 50 cents, but you actually don't fund the places that need it and the people that need it. Help the corporations, but don't help the corporations like we did in 2008, where the senior executives get tens of millions of dollars in bonuses, and now the taxpayers are supposed to fund that corporation to bail them out, and then the corporation 2 years from now is making record profits, and the normal economy hasn't rebounded, and the taxpayer who subsidized the corporation is still struggling to pay their mortgage. We did that in 2008. You want to give a corporation money? Say, okay, here are the rules. You can't buy back stock. I want the bonuses to CEOs back. I want an equity stake in the company. I want interest in the company, an interest rate on the loan, but something that gets the profit back to the citizen. You know, we're tired of making these big corporations rich at taxpayers' expense. Make sure the corporations live up to their civic responsibility, and you have total responsibility. If you're going to give them taxpayer money, then you get to write the rules. You know, from the president's point of view, this is back to his old job, right? Somebody walks in and says, I want an investment in my company. Okay, I'll give you an investment in your company, but here are the rules before I give you the investment in that company. I need the federal government to do that. The emergency supplies, the funding to the places that need it. I need my congressional delegation to actually represent the state of New York and deliver. We need FEMA here. We need Army Corps of Engineers here. We need those functions working as quickly as possible. And then we need federal assistance from the federal government. If none of that happens, then we're on our own. We're New Yorkers. We'll figure it out. Why don't you say? I'm sorry?
Does the eviction waiver mean no need for rent freeze?
Does the eviction waiver mean no need? You cannot be evicted for non-payment of rent. One other piece of good news. You know, we talk about all these increasing cases, and you get the virus. Most people, the virus resolves. A good friend of mine, great public official, Rick Cotton, head of the Port Authority, he had the coronavirus, never hospitalized. He was home for 2 weeks. He is now tested negative for the coronavirus. So he self-resolved. It was about 2 weeks. I don't even know that he needed all 2 weeks. I'm a little suspicious that maybe he resolved in 1 week and then he just took another week vacation, but I don't want to push the point. I'm going to go to work. Thank you guys very much. The state what?
All right, so we were listening to Governor Andrew Cuomo there from New York, talking just about, well, that was earlier today, but here we go. It looks like we are getting ready. The coronavirus task force is now coming up to the podium here. We are now moments away from President Trump coming to that stage with the vice president, along with other, as you can see, members of the White House coronavirus task force team as they are coming together. It was originally slated to be a earlier news conference, but then it kept on getting pushed back, and now we are awaiting President Trump coming to the podium, and looks like we just got our 2-minute warning here. We appreciate everyone joining us worldwide on coronavirusnow.com. We will see what the president has to say. This has now become a daily occurrence where the president comes out for about anywhere from an hour to 90 minutes, gives some introductions, and then does his prepared statement. And then some of the other team members get to the podium before the question and answer round comes from the media there. And, well, we are going to see here is now the U.S. is unfortunately, now third with the most number of cases around the world here. We have now more than 31,000 cases worldwide. 31,000 cases in the U.S. And we will now wait see what the president has to say today here. Door comes up. Here comes the president. We are watching live, and we are going to listen right now.
Thank you very much. Just before we begin, I want to mention we're working very hard, long on getting a young group of people out of Peru. We've removed some, and the rest are being removed with the cooperation of the Peruvian government. And we're also dealing with Honduras on getting some people out that got caught up, and we are working on that very well, again, with the Honduran government's work, and they're working with us, so I appreciate that. We have a couple of other locations that we'll report to you, and we were able to get a young woman released from a certain area who was being horribly accosted, horribly treated. And we spoke to General Milley. General Milley took care of it. We went in and we got her out. And we'll report further on that one. But that was rough stuff. I want to thank General Milley. I want to thank all of the people that were involved and the people that went in to get her. I want to thank you very much. As we continue to marshal every resource at America's disposal in the fight against the Chinese virus, we're profoundly grateful to our nation's state and local leaders, doctors, nurses, law enforcement, and first responders who are waging this battle on the ground. It is absolutely critical that Americans continue to follow the federal government's guidelines, so important, about social distancing, non-essential travel, and hand washing. Defeating this unseen enemy requires the help and commitment of every single American. I want to just say that Senator Rand Paul, a friend of mine, he's been a great friend of mine. He's been always there when we needed him, when the country needed him. And as you know, he just tested positive. Jose Diaz-Balart, spoke to him yesterday, tested positive. And some people are they're getting quite close to home. And it's a terrible thing that's going on. The hidden enemy, I call it the hidden enemy. And I think they'll all be fine. I hope they're going to be fine. But I just want to send our regards. And I think I can speak on behalf of our country to those two great friends of mine. We're working urgently with Congress on legislation to support the millions of workers, small businesses, and industries who've been hit hard by the virus through no fault of their own. Our goal is to get relief to Americans as quickly as possible so that families can get by and small businesses can keep workers on the payroll. This will help our economy, and you will see our economy skyrocket once this is over. I think it's going to skyrocket. It's a pent-up demand. It's a built-up demand, and I guess you really have to say who knows, but I think it's going to be a tremendous day when we win this war, and we will win the war. We want to win the war with as few, if you look at it, just deaths as possible. We want to have as few number of deaths as possible. Today I'm announcing action to help New York, California, and Washington ensure that the National Guard can effectively respond to this crisis. the National Guard. These are tremendous people. They're fully on alert. We've signed what we had to sign, and it's been activated. We're dealing also with other states. These states have been hit the hardest. Actually, pretty much by far, you could say the hardest. Everybody can see that. Just look at the numbers. And through FEMA, the federal government will be funding 100% of the cost of deploying National Guard units to carry out approved missions to stop the virus while those governors remain in command. So the governors locally are going to be in command and will be following them, and we hope they can do the job, and I think they will. I spoke with all three of the governors today and just a little while ago, and they're very happy with what we're going to be doing because we'll be announcing some other things for those three states and some other states where it's hit the hardest. This action will give them maximum flexibility to use the Guard against the virus without having to worry about costs or liability, and freeing up state resources to protect the health and safety of the people in their state. The federal government has deployed hundreds of tons of supplies from our national stockpile to locations with the greatest need. In order to assist in those areas, I approved the state of New York's request for a major disaster declaration, something which Governor Cuomo has been asking for and which I agree, and we had it done in very rapid fashion. We approved this on Friday evening, and we are working very, very hard to get all of these things not only signed up, but completed and finished and win. The request from the state of Washington for a major disaster declaration was approved just a little while ago. Went through the process, and we moved it very quickly. The request from the state of California was just received, and we will have it approved very quickly. We'll be working. I told that to Gavin Newsom, and we're working on getting that done very quickly. It'll be done maybe tonight. We have large quantities of medical equipment and supplies on the way based on all of this to those states, including respirators, surgical masks and gowns, face shields, coveralls, and gloves, with large quantities already delivered to Washington and to New York. In addition to large quantities of supplies, I've also directed FEMA to supply the following: 4 large federal medical stations with 1,000 beds for New York, 8 large federal medical stations with 2,000 beds for California, and 3 large federal medical stations and 4 small federal medical stations with 1,000 beds for the state of Washington. The governors know. The supplies en route to California and New York will be delivered within the next 48 hours. In addition, the Naval Hospital ship, the USNS Mercy. It's incredible ships. These 2 ships are incredible, one on the West Coast, one on the East Coast, will be deployed to Los Angeles to add emergency surge medical capacity, and they have a tremendous capacity. They are really something. I will say that if you look at some of the things we've been doing, and now those numbers have gone up, and just to be a little bit more exacting, we've done a presidential approval for requests for major disaster declaration for the state of New York, approval of Title 32 National Guard activation for the state of New York. We're providing all of this at no cost to the governor. I spoke with Governor Cuomo. He's working hard. We're all working hard together. The relationship has really been amazing. But it also enables the governor to provide robust National Guard support to the state. And the 25%, we're going to be waiving that 25% cost. We're picking up, we'll be coordinating, and they'll be doing something with very special people. Mission assignment of the U.S. Army Corps of Engineers to provide support to build out alternate care sites. They're doing various alternate care sites, which have now been designated by New York. 4 large federal medical stations of 1,000 beds. These are very complex places, actually, with great equipment and great people. Strategic National Stockpile Order, and this is as of a number of days ago, so far delivered to New York, and this is the 19th, we had the N95 respirators, 186,416 delivered. We've delivered 444,078 surgical masks. Many have been delivered since then. Face shields, we've delivered 84,560 face shields. Surgical gowns, 68,944 to New York. Coveralls, 352. Gloves, 245,486. Also to New York, in terms of what's been delivered just since then, the numbers are quite large, and we have tremendous numbers of companies also making equipment. For the state of Washington, we've delivered 369,000 N95 respirators, 507,406 surgical masks. And this is as of about 3 days ago. Face shields, 63,788 face shields. Surgical gowns, 107,850. Gloves, 240,376. And we have many, many things pending. It's actually not pending. They're being fabricated. They're being made, and they're moving. Now, for Washington, so we have 4 small federal medical stations, 250 beds. And for Washington, state of Washington, we have 3 large federal medical stations, 750 beds. And then you have, as I said, the approval of the Title 32 National Guard. State of California, again, to be very precise, we're going to have the approval of the Title 32 National Guard activation. And we're providing all of this, again, like in New York, at no cost to the governor, meaning to Governor Newsom and the state, no cost to the state. It enables the governor to provide robust National Guard support to the state. So they're going to have control of the National Guard. Federal government sending, these are incredible people that are being sent. We have 8 large federal medical stations with over 2,000 beds, and that's going to California. And then strategic national stockpile order. We've ordered likewise hundreds of thousands of different items. I won't go into the exact numbers, but the numbers are very substantial. But we're having tremendous additional numbers sent. And whatever the states can get, they should be getting. I say we're sort of a backup for the states. And some of the states are doing really well, and some don't do as well. The ones that don't do as well need more help. But these are 3 states that really do need help because they are hit very hard. And the outpouring from the private sector has also been extraordinary. I'm pleased to report that Honeywell, great company, has just announced it will immediately expand its personal protective equipment manufacturing operations in Rhode Island to produce millions of additional N95 masks. They're very hard to get. They're actually quite complex. For the U.S. government's strategic national stockpile, they'll be immediately then delivered to the various states. This expansion is already underway, and it's going to provide a lot of jobs for that state, probably around 500. The masks will be distributed by the government for the use of the health, safety, and emergency, and this for response workers, primarily for response workers. These are very high-end. This expansion is, in addition to Honeywell's action, to more than double production of its existing personal protective equipment manufacturing plants. They make a lot of different things, and they're doubling and tripling their production. They're going round the clock. Today, I'm also announcing the launch of a new public-private consortium organized by the White House, the Department of Energy, and IBM to unleash the power of American supercomputing resources to fight the Chinese virus. The following leaders from private industries, academia, and government will be contributing. And they're going to be contributing a lot of different things, but primarily computing resources to help researchers discover new treatments and vaccines. They'll be working along with NIH and all of the people that are working on this. But tremendous help from IBM, Amazon, Google, Microsoft, MIT, Rensselaer Polytechnic Institute, the Department of Energy's National Labor Laboratories, the National Science Foundation, and NASA. They're all contributing to this effort, and they're fully in gear. This afternoon, I also want to update you on the steps we're taking to protect and serve our country's 18 million veterans. These are great people. Our amazing veterans have shown their eternal loyalty to our nation, and this is the time where they're in need, and we are going to show our loyalty to them. We're being very protective of our veterans. We're working on certain hospitals where we may be doing some veterans hospitals. We're going to be very protective of our veterans. Some of them are of that very vulnerable age, and some of them obviously are not feeling well, and some of them are still suffering the wounds of war from many years ago. Yesterday, I signed vital legislation to ensure that the GI Bill will cover distance learning during this emergency. I also spoke with many of our veteran service organizations, or the VSOs, to describe our unprecedented action. In February, the Department of Veterans Affairs established 19 emergency operation centers throughout the country. One of the things that they've been trying to get done for many years, you all know this from following me over the last number of years, but we got it done pretty quickly. They've been trying to get it done for many, many decades, was choice, veterans' choice, and also veterans' accountability. Now, if it's crowded within this, if they can't get to a doctor, we have great doctors in the VA. I have to say that. We have fantastic doctors, as good as they come, but it's hard to get to them because of what was bureaucracy, but no longer bureaucracy. We've done a lot of things, in that case, because of accountability. When people aren't doing their jobs, or if they're bad, or if they're sadistic, or if they steal, or anything bad happens, we're now allowed to fire them for, I signed that a year and a half ago. For many years, you weren't able to do that. So the VA is working, and I was just told by our great leader at the VA, Robert Wilkie, he said for the first time, we get the highest marks in the history, highest poll numbers in the history of the Veterans Administration. Came out a week ago that they're happy. And look, one of the reasons that happened, highest in history, one of the reasons that happened is because of veterans' choice. If they have to wait online, they go and see a private doctor and we pay the bill. And they get better. They don't have to wait 2 weeks and 3 weeks or 2 days, but they get better. And a lot of times they waited so long that they would have a problem, and it would end up being terminal because they couldn't get the kind of treatment that they deserve. So highest poll numbers, highest approval numbers in the history of the VA. I was just given that information yesterday. We restricted visitors' access to 135 veteran community living centers, which house nearly 8,000 veterans with chronic medical conditions, so that we limit their exposure to the virus. We want to totally take care of our veterans, and that's what we're doing. The VA has canceled most elective medical and surgical procedures. They're delaying them till after this is gone, after we've won. We began providing life-saving care to patients who had symptoms across the 171 VA medical centers nationwide. That's a big deal. Under my administration, the VA has also been a leader in expanding telehealth. Telehealth is becoming a bigger and bigger factor in medicine. This month, we have taken bold action to cut through the red tape and make telehealth available for millions more Americans during this crisis. They can speak to a doctor from the safety of their home rather than risk becoming infected or making a tremendously long trip, when, frankly, you'll speak to a great doctor right from your home. It's happening, telehealth. We're very much at the forefront of that, too. We're very proud of it. And it also takes a big burden off our system. We continue to accelerate the development of safe and effective vaccines. We're also aggressively investigating a number of antiviral therapies and treatments to determine their potential in reducing the severity and duration of the symptoms. And you know how I feel, because how I feel is on Tuesday, they're going to be starting it on Tuesday morning. And we're going to have some medications delivered that we're going to see if they work. They certainly are effective in other ways, and they are safe from the standpoint is that they're not killing people. We're not going to have that. So a lot of great things have been happening in that regard. I just want to finish, and then we're going to ask a couple of people to say a few words that have been so much in the forefront of this incredible job that we've all been given. But I want to say that I know that this is a challenging time for all Americans. We're enduring a great national trial, and we will prove that we can meet the moment. I want to assure the American people that we're doing everything we can each day to confront and ultimately defeat this horrible, invisible enemy. We're at war. In a true sense, we're at war, and we're fighting an invisible enemy. Think of that. For those of you who are feeling alone and isolated, I want you to know that we are all joined together as one people, eternally linked by our shared national spirit. We love our country, a spirit of courage and love and patriotism. No American is alone as long as we are united, and we are united. We're very united. People are saying things now that 3 weeks ago, they didn't talk that way. We're very united. No force is equal to the strength of really a unified America, united America, an America like we have it right now. For those worried and afraid, please know as long as I am your president, you can feel confident that you have a leader who will always fight for you, and I will not stop until we win. This will be a great victory. This is going to be a victory. And it's going to be a victory that, in my opinion, will happen much sooner than originally expected. It's now attacking, the enemy is attacking 144 countries at this moment. 144, that's unthinkable. There's never been anything like this. And it's vicious. It is vicious. Some people recover well, and some people have a hard time. We all know that. But we will be totally victorious. We will then get our economy up to a level that it was, and in my opinion, beyond, because that will be a pent-up demand. There is a pent-up demand, and a lot of great things will happen. But I'm very proud of our country. I'm very proud. I'm very proud to be your president, and it's just something that's just, you're very special people. So thank you very, very much. And I'm going to ask, if I might, a combination of Pete. Why don't you start off? Okay, please.
Thank you, Mr. President.
Thank
you. Just a little bit about what we're doing in Washington, California, and New York. We understand that the states of Washington, New York, and California are the areas seeing a steady increase in COVID-19 virus cases. In order to assist with additional needs identified in those areas, the state of New York was approved for a major disaster and declaration this morning. Washington State was also approved earlier today. California submitted their request, and the president will consider it immediately. We have medical supplies en route to these states, including respirators, surgical masks, gowns, face shield, coveralls, gloves, with quantities already delivered to both Washington, New York, and California. And we anticipate additional supplies to be delivered within the next 42 hours to all these states. Under President Trump's unprecedented national emergency declaration on March 13, FEMA is assisting state, local, tribal, and territorial governments, including reimbursing eligible emergency protective measures taken at the direction or guidance of public health officials in response to this emergency. All 50 states, the District of Columbia, 5 territories, and 2 tribes are working directly with FEMA under the nationwide emergency declaration for COVID-19. With the assistance of the FEMA regional administrators who are throughout the country, we are working to address the needs of state and local officials everywhere. States, tribal, and territorial governments do not need to request separate emergency declarations to receive FEMA assistance under this nationwide declaration. The emergency declaration does not authorize direct financial assistance available to individuals such as disaster unemployment assistance or other needs assistance at this time. Just a note on the USNS Mercy. Based on analysis of potential needs for hospital beds on the West Coast, the decision was made that the USNS hospital ship Mercy would have the greatest impact in California. The Department of Defense has been given direction to dispatch it to Los Angeles immediately. DoD has advised that the Mercy can get into position within a week or less of today's order. Even though there are more cases right now in Washington, the projected needs for beds in California is 5 times more that of Washington. The Mercy will be used to take pressure off local hospitals, other medical needs, and not for treating COVID-19 cases. And finally, a little bit about the National Guard. The federal government continues to take aggressive action and proactive steps to address the COVID-19 threat as we attack the health and safety, or protect the health and safety of the American people. It remains our top priority. The National Guard is especially posted and equipped to assist federal, state, local agencies while serving the public. In response to this unprecedented nationwide operation, President Trump has approved Washington, California, and New York National Guard units under Title 32 status for the COVID-19 response. The President's action provide the nation's governors continued command of their National Guard forces, enabling states to use additional resources to meet the missions necessary in the COVID-19 response. The National Guard is a viable and responsive avenue to provide a much-needed asset that is state-managed and federally supported. And I want to be clear, this Title 32 activation does not federalize National Guard members. The National Guard is still under the authority of each governor. They will work in concert with the Department of Defense. And we've had a lot of disinformation circling, and I want to make sure it is understood that this is not martial law. The Department of Defense, by way of a mission assignment, will lead this task. And then finally, we continue to respond to hundreds of requests from governors across the country in filling all their critical needs. Thank you, sir.
Thank you, Pete, very much. Good job. Peter Navarro. Thank you, sir.
Thank you, Mr. President. Good evening. What I want to talk briefly about is the Defense Production Act. And to give you the overview here, using the full power of private enterprise and the full force of the federal government, my job at the White House is to make sure, tactically, working with FEMA and HHS, the American people, particularly our healthcare professionals, get the gloves, the masks, and all of the personal protective equipment they need. And I can tell you, sir, that since you signed the Defense Production Act, my job's gotten easier. And let me explain why. The Defense Production Act, in this context, has 2 primary functions. One is mobilization of the industrial base, in this case, the public health industrial base, and the other is allocation of resources, both from the supply chain to the manufacturers and from the manufacturers to the end users, such as the healthcare professionals. Now, what we're seeing on a purely voluntary basis, based on the leadership of this administration, we're seeing the greatest mobilization of the industrial base since World War II. And every day I'm working with organizations and companies, National Association of Manufacturing, the National Council of Textile Organizations, and so on, in terms of building up rapidly our capabilities to get what you need. Now, let's think about what mobilization means. It can mean, for example, repurposing a factory. So Pernod Ricard called us last week, and they had 3 hurdles they had to deal with. They called my office, had to make a call to Treasury, FDA, and HHS to clear the path. We got that done that day. They started their production that day, moving from alcoholic beverages to hand sanitizers, and as we speak, a truck is moving towards New York and will arrive there Tuesday to share with the hospitals over 1,000 gallons of sanitizer. So that would be a repurpose. A second example would be one that the President offered with Honeywell. Again, Honeywell called the White House asking for help from the President. And what they said is, look, we want to do this new factory in Smithfield, Rhode Island. They called me on a Friday morning. And by that night, we had a contract in to HHS. HHS flipped that immediately, and I had Honeywell moving people and equipment from Massachusetts to that facility in Smithfield, Rhode Island, and we're going to have those masks produced within 30 days, moving on the assembly chain. So my point is, mobilization is repurposing, building up capabilities. And the other portion is, of course, the allocation of resources. Now, what I can tell you so far is that the Defense Production Act, sir, has given me quiet leverage. When you have a strong leader, you can take a light hand initially. And so what we've seen with this outpouring of volunteers from private enterprise, we're getting what we need without putting the heavy hand of government down. There will be possibly cases down the road, and the manufacturers have actually asked me and alerted me this, where some places in the supply chain, they may have problems that the White House will have to break through using the Defense Production Act. We won't hesitate to do that. The last thing I'll tell you is that I also get a lot of calls that are very disquieting. Brokers are offering millions of items, whether they're goggles, masks, or whatever, and you go through 3 different brokers, tracing to a warehouse in L.A. that's allegedly got 10 million masks, and they want to charge you 7 times what they cost. That's price gouging. We are a message to the hoarders. If you got any large quantities of material that this country needs right now, get them to market or get them to us. We'll pay you a fair price. But if you don't do that, we're going to come for you and make sure that doesn't happen in this country, and that would be a good use of the Defense Production Act. So I salute you, sir. You've made my job easier, and I appreciate that.
Thank you, Peter, very much.
Great job.
Mike, please.
Thank you, Mr. President. Task Force met this afternoon, as we do every day. And let me begin today by simply saying thank you to the American people. And thank you for the way that people across this country, 7 days into 15 days to slow the spread, the people in communities large and small across America are responding, are cooperating, are communicating, not just on behalf of their own health and the health of their family, but more importantly, on behalf of the most vulnerable among us. So on behalf of your president, and our entire task force, just thank you to the American people. I also want to express our appreciation to the governors across the country. The President today just announced action in New York, California, and Washington State as the latest demonstration that this administration will do whatever it takes to support the leadership at the state and local level as the American people confront the spread of the coronavirus. The legislative efforts that are underway, being negotiated on Capitol Hill as we speak, the bipartisan spirit that's taking place there, that's reflected in all of our interactions with state leaders around the country, is a great credit to the nation. But it should be a great encouragement to the American people that your government, at the federal level, at the state level, working with courageous healthcare providers all across America, are coming together to meet this moment. And that is the way our system works. It's extremely important that the American people recognize that one of the things that makes America different is that we have a system of federalism, and that by putting FEMA in the lead, the president has emphasized that our response to the coronavirus is in the anthem of FEMA, it is locally executed, state managed, and federally supported. We want the people on the ground, the decision makers, to have what they need. We want states to be able to manage the unique circumstances in their states. And whether it be the legislation moving through the Congress or the efforts the president announced today, major disaster declarations, Title 32 on the National Guard, resources flowing, hospital beds flowing, we're going to continue to make sure that our states have what they need to meet this moment. Our task force continues to focus on the priorities the President's given us. They are testing, mitigation, and supplies. And on the subject of testing, as is evident to people across the country, testing is more and more available every single day. We'll be detailing tomorrow from this podium the progress that we are making on tests. At this day's reporting, 254,000 Americans have been tested and received results in coronavirus tests, with slightly more than 30,000 actually testing positive. There's a bit of an encouraging word in that for every American. Remember, everyone that's being tested now, with the exception of our healthcare workers, are people that have symptoms that make them think they may have the coronavirus. and as our numbers come in consistently, because the 254,000 does not include all the local hospitals or all the local labs in our states, it's working out to be about 1 in 10 Americans who've been tested who thought they had coronavirus actually had it. 9 out of 10 did not. But we'll continue to roll out the testing to provide that resource to the American people. And we're working to make testing happen faster. We expect from word from the commercial labs that we should be caught up on the backlog in testing by the middle of the week. And we are urging today, on the President's behalf, that all labs would prioritize inpatient testing. Let me say again, to all of the commercial labs in the country, you will receive guidance from HHS tomorrow. But on behalf of the President and the White House Coronavirus Task Force, we are urging all commercial labs to prioritize inpatient testing. We want people that have been checked into a hospital that are being treated for what they suspect to be coronavirus to receive those tests more quickly. Also, I'm pleased to report that yesterday the FDA approved an emergency authorization on a new test that should be in production by the end of March. It actually would be a coronavirus test, the results of which come back in 45 minutes. And we're also working, the FDA is working with manufacturers around the country to come up with even faster, more innovative tests. And as we told our governors in several calls this week, governors and state health officials should simply contact FEMA for the latest information on testing solutions. Let me also say, tomorrow when we gather at this podium, we'll be unveiling, with Dr. Bob Redfield in the lead, new guidance for people that work in law enforcement, first responders, people that work in what we call critical infrastructure in the country. It was in early March the CDC issued guidance for people that were asymptomatic or did not have symptoms, but who had been exposed to someone with coronavirus. We gave them guidance about being able to return to work wearing a mask for 14 days. And tomorrow at this podium, CDC will unveil, in cooperation with the Department of Homeland Security, new guidance which will make it possible for people that have been exposed to return to work more quickly by wearing a mask for a certain period of time. Let me also amplify a point on behalf of the President and on behalf of the State Department about Americans abroad. You know, one of the reasons why the United States is in a different position today than portions of Europe are, and China and elsewhere, is because the President suspended all travel from China. He suspended travel from Europe and the UK and Ireland. But the State Department is working around the clock to assist Americans who may find themselves overseas. They're able to come home. There's no barrier to Americans coming back to American soil. They're screened when they come home through a series of airports. But we're aware that with flights being canceled, some Americans have found themselves unable to find a way home. And as the President said, we've been working very diligently through the State Department to make it possible. Their commercial flights have been chartered. We're also working with the military for a backup on flights. At this point, the State Department has brought more than 3,000 Americans back home. But speaking to the Secretary of State today, he wanted me to share a website and a phone number for any American that might be looking on from overseas. You can call the Smart Traveler Enrollment Program at 1-888-407-4747. Or you can go online at step.state.gov. This will allow our embassies and consulates to gather important information about your situation and work to facilitate to bring you home. Let me say finally, as I began, let me close. As the chairman or the leader of this White House Coronavirus Task Force, we are 7 days into 15 days, and the American people are responding. Because as we speak about supplies, as we speak about testing, the most important thing every American can do is heed the guidance and the direction from your state and local officials, particularly in areas where we have widespread coronavirus infections. But for every American putting into practice these measures that the President alluded to at the very beginning of his remarks is a way that we can do this, America. That we can lessen the magnitude of the coronavirus in our country with the cooperation, compassion, generosity, and prayers of the American people, we can slow the spread, we can protect the most vulnerable, and we can heal our land. So let's do it, America.
Thank you, Mike, very much. Thank you. Thank you very much, Mike. So just a couple of little things that will take some questions. Maybe you will have some, maybe you won't. That'd be a shock. It will shock the American public. But I have to say on the testing, if this works out, and we think it might, the new test will be a very simple one, much easier than the existing test, which is quite complex and not a lot of fun to take. And this will be a game changer. But remember, we inherited a broken, obsolete system. It was good for a small number of people, but not good for the millions of people that we're talking about. And we've made this into a system that no matter where you go in the world, that's where they're going. That's what they want to do. That's how they're going to be doing it should something like this happen again. So our people have done a fantastic job, really a fantastic job. And I hope the new test works out. We'll know fairly soon, I think, Doctor. We're going to be knowing about that fairly soon. Hopefully it'll check out or test out. And we certainly are looking forward to that. That will be a very simple test by comparison. Won't be unpleasant at all. And one other thing, the ships. So we have the Mercy, and it's going to California, as you know. That's on the West Coast now. And you have a sister ship that's essentially a twin. They're incredible. I mean, they're incredible ships. I've seen it. I've seen one of them, and they are unbelievable what they can do and the capacity. Many operating rooms, you know, they're wartime ships. They're meant for war. Many, many operating rooms, stainless steel. These rooms are as good as there is anywhere in the nation, actually. I spoke with Governor Cuomo. We had a great conversation today, a number of conversations, actually. He's working very hard. And we are going to be bringing that ship that's called the Comfort. So you have the Mercy and the Comfort. The Comfort's on the East Coast. And that ship will be coming over the next 3 or 4 weeks. It was in the middle of maintenance, and we are moving the maintenance very, very quickly, and we're also supplying the ship simultaneously. It's actually big supplies going into those ships, big. And that ship will be coming up here over the next few weeks, and we'll probably be putting it in New York Harbor. And we're making arrangements for that also as to where it's going to be docked. So you have the Mercy and you have the Comfort. They'll be coming up. The Mercy will start very, very quickly. It'll be arriving in Los Angeles pretty soon. So we look forward to that. A question? ABC, go ahead.
Thank you. First of all, Senator Paul testing positive. When's the last time you had in-person contact with him?
Gee, I think it was quite a while ago. I don't
But
know.
also,
It's been a long time.
on top of Senator Paul, now 4 senators are in isolation, and the rules say that in order to vote, they have
Who
to
are
be
they,
there.
please? Who are they?
Romney, Senator Lee,
Senator Gardner, Senator Rick Scott.
Senator Rick Scott. Also, 2 of them were in contact
I
with.
guess Rick is
with
coming out.
With the critical stimulus package vote expected.
Romney's in isolation?
Yes.
Gee, that's too bad. Go ahead.
Detect sarcasm there,
No,
sir?
none whatsoever.
Do you think that Congress should consider changing the rules to allow them to vote remotely if it comes to this critical stimulus?
I was thinking about it today, and I'm saying, you know, you could have a lot of senators and a lot of House members. I spoke last night with a very, very good man who happens to be in the House, as you know, and he's just started, and he tested positive. So you could have a large number of people in there from Congress. You could have, between House and Senate, you could have a large number. And I think it's something, at least, I mean, I fully understand why you should be there. I think it may be a constitutional reason why you should, but we could be in a position where I would certainly be in favor of it, where they could vote from a certain outside location. I would be in favor of it. I was thinking about it today. I mean, we could be in this, look, with what's going on, nobody's ever seen anything like this. You could have a lot of people in there from Congress, and it would certainly be, they may tell me there's a reason constitutionally, and there may be, but I would be totally in favor of it on a temporary basis.
It does seem like negotiations still have a ways to go on the stimulus package. Are you concerned about the timing at all? And the
Well,
message it sends?
we have an interesting thing. You know, we all want to get to the same place, but we have different. We want to, and I just wrote this down just a little while ago. We want to protect the worker very much. So do they. So do the Democrats. We also want to protect the worker through their companies. We don't want to necessarily. We're going to help the worker anyway, but ideally they can go back to one of their great companies. You know, you have great companies that are in financial trouble now, and we need money to help those companies so they get back into where they should be, health. You know, most of these companies 4 weeks ago were having the best year they've ever had. Last year was the best year, almost all of them, other than Boeing, which is incredibly had problems, big percentage of GDP. But we have to be able to work with Boeing. Boeing was a great company and will be a great company again, I think, shortly. So we have to work with the companies, and they don't want to do that. It's crazy. They don't want to do that. I don't want stock buybacks, so I don't know where the problem is there, but I know that's one of the things that they're talking about. I do not want stock buybacks. I don't want to give a bailout to a company and then have somebody go out and use that money to buy back stock in the company and raise the price and then get a bonus, okay? So I may be Republican, but I don't like that. I want them to use the money for the workers. I want them to use the money for the company, to help the company in the airline business to take care of their planes and all of the things they have to do, including buying new planes. But I don't want stock. I don't want to have any stock buybacks. The Democrats are with me. I don't know what the problem is on that one because I can't imagine that is too tough. We want to be able to take care of our people. You're going to have things coming up. We're going to have some of the elements that they're talking about. They're down to, I mean, literally 95% of things that you would think that they wouldn't agree, and you'd think the Republicans wouldn't agree to it. And unemployment, as an example, is one of the things they talk about, and unemployment insurance. I think we're very close on that, but, you know, right now they're not. So right now they're not there. But I think that the Democrats want to get there, and I can tell you for a fact the Republicans want to get there. And I don't think anybody actually has a choice. It's a bold package. It's a big package. We do have money for, one of the things is we do have money for saving small businesses. I don't imagine the Democrats, because we have a lot of money set aside for small businesses. We also have a lot of money set aside for big businesses. You know, the big, powerful companies that were powerful 4 weeks ago, and today they're overextended. Look at the cruise line. That's a tremendous business, a big business, very important to Florida. And it's unthinkable a month ago. Just unthinkable. They were setting all sorts of records. They're building new ships. We can't let the cruise lines go out of business. I mean, that would be massive numbers of jobs for our country, and actually for the world. But for our country, it's a massive business, and it doesn't take much to keep them going. So we have to provide for that. But I think both the Democrats and the Republicans are agreed that we have to take care of our workers, and we're going to be doing that in numerous ways, including a substantial cash payment. Yeah, please.
When it comes to the Defense Production Act, we know that governors across the country all day today were pleading with you to utilize the DPA, saying that they need it specifically for that allocation piece that you mentioned, Mr. Navarro. Okay. Why not use it now if that would answer their pleas for help?
Well, we are using it now. The fact that I signed it, it's in effect. But, you know, we're a country not based on nationalizing our business. Call a person over in Venezuela, ask them how did nationalization of their businesses work out? Not too well. The concept of nationalizing our business is not a good concept. But I'll tell you why. As Peter said, we may have to use it someplace along the chain, but we're getting calls. Here's the beauty of it. If we go out and we want, let's say, masks, we don't know who to call on masks, but Hanes, who makes things of cotton, various elements, lots of things. It's a great company. They called us, and they said, we're going to make millions of masks. We got a call today from 3M. There's a big article today, the head of 3M. They're going to make tremendous products, and they're more or less in that business. And if they're not, like, for instance, General Motors spoke to us, Ford spoke to us about doing ventilators. The beauty is they're calling us. If you go the national route, nationalization route, we're going to tell a company to make a ventilator. They don't even know what a ventilator is. In the case of one company, they used to make them years ago, and they know how to make them. You know, it's a very complex piece of equipment, frankly. So what we're doing is, I think Peter said it maybe better than anybody's going to say it. We have the threat of doing it if we need it. We may have to use it somewhere along the supply chain in a minor way. But we have millions of masks being done. We have respirators. We have ventilators. We have a lot of things happening right now. So just the threat of using it. But using it's actually a big deal. I mean, when this was announced, it sent tremors through our business community and through our country. Because basically, what are you doing? You're talking about you're going to nationalize an industry, or you're going to nationalize. You're going to take away companies. You're going to tell companies what to do. The truth is, most people, nobody would know where to start. There are companies out there that you wouldn't think of that have called us that say, we can do ventilators. We used to do them years ago, and they can do them in large quantities. If I call companies and say, you build ventilators, they don't even know what a ventilator is. So it's really working out very well. One of the reasons I read the numbers to you is because we've given vast numbers of just about everything. We've taken it out of our supply, and we're restocking our supply. But we're really backing up the governors. The governors have to go out, do their things, and you have a lot of governors. They've done a fantastic job. You have some that haven't. Usually it's the ones that complain that have the problems. But we've had a great relationship, as an example, with Governor Cuomo, with Governor Newsom. We've had a great relationship with the state of Washington. Those are three hotbeds. Those are three hotbeds. Now, we're also dealing with other states. As the Admiral said yesterday, we're dealing with all of the states, actually, in one form or another. Some are very affected in a very minor way, where you have 2 people or 3 people. And I don't even mean deaths. I mean literally cases. And that's different than New York, where you have, tremendous, where everybody, I lived there for a long time, everybody's extremely close, tight. And you have a lot of cases in New York. You have a lot of cases in New York. And we're helping Governor Cuomo. We're helping Governor Newsom. They've been total gentlemen. They want to get it done, and we want to get it done. But doing it the way we're doing it is much better. It's really much better.
But in terms of this, I'm asking about the supply chain. It's about allocation, not about manufacturing. So the companies, it's not about nationalizing the companies. It's about the allocation.
We coordinate with the states, and we are coordinated with the states. And for the most part, the coordination's been very good. Look, 3 days ago, I had a phone call with all the governors. I actually allowed the press to stay. They weren't supposed to stay. And one person in the media said, that was surprising. It's actually a little risky doing that, because we had Democrats and we had Republicans. And, they're politicians, and they always have something to say. Well, I took a lot of calls, and we really didn't get one nasty or bad response. They were thanking us for the job we did. And I had the press standing. I don't know if you were there. I don't think so. I had the press standing there watching. They weren't supposed to be there, but I said, let them stand there. The governors were very complimentary. Very, very complimentary. And I watched over the last few days Governor Cuomo. I watched Gavin Newsom in California. I watched both of them, and they've been, very complimentary. And those are really the hotbeds. And so we want to keep that going. I'm very proud of this country, and I'm frankly very proud of a lot of the politicians that normally we're fighting with. We have different views on things, a little different view. But we're going to get to the same place. We have different views, but we're going to get to the same place. Yeah, please.
Yes, I wanted to ask if you're considering an executive order to free elderly, nonviolent criminals from federal prisons.
We have been asked about that, and we're going to take a look at it. It's a bit of a problem. But when we talk about totally nonviolent, we're talking about using totally nonviolent prisoners. We are actually looking at that, yes.
Thank you. And a quick I wanted to ask also, your administration eliminated a key position in China in July, a medical epidemiologist embedded in China's disease control agency, and it was just months before the first cases were spotted in Wuhan. So the question is basically why the post was eliminated. And
well, I could ask anybody. Would you like to take that one, Bob? But this is just like all of the other stuff that not you, but that the press was asking, all of which turned out to be, we actually gave CDC more money, not less money. They said we defunded. It turned out it was more money. Every one of those things that were said were 100% wrong. And this sounds like another one of them. But anyway, go ahead.
Yeah, as you know, CDC has offices all around the world right now to do our
function to detect and prevent and respond to outbreaks where they occur. The China office is actually being augmented as we speak, and we've been embedded there for over 30 years. There's a reason they call it the Chinese CDC, because we've had that productive partnership.
Mr. President.
And I wish, again, our relationship with China is a very good relationship. I wish they told us 3 months sooner that this was a problem. We didn't know about it. They knew about it, and they should have told us. We could have saved a lot of lives throughout the world. If you look at what's happening in Italy and Spain and a lot of other countries, we could have saved a lot of lives throughout the world. Kelly?
Mr. President, given the diagnosis for Senator Paul and people being self-quarantined, what concerns do you have about the direct threat to the function of the Senate, the ability to get this important package that people are waiting for passed? And should Americans be expecting you to extend the 15 days, given the climate of how this is spreading at this point?
Well, I hope we won't have to. It's possible, but we'll have to see how that works. As far as the Senate is concerned, we are looking at some of the folks are feeling very good. Some are quarantined, but they're negative. It may be totally fine. Okay. Others are positive. We're just finding this now for the first time. I mean, over the last 2 days, we found that.
Do you see it as a threat to the aid package that Americans are waiting for?
No, I don't see any threats at all. Honestly, I don't see any threats at all. It'll all work out. It is a question, and a very good question, I thought, that we are considering. Now, I don't know if you can do it constitutionally, but we are considering letting people vote, senators, congressmen and women, vote from a outside, namely a hospital or a home, depending on where they are. So we are looking at that. It's a little trickier question most people would believe, but we are looking at that very strongly.
Mr. President, speaking of this, I think Kelly was kind of alluding to it. While we've been up here, they weren't able to get the 60 votes to move the package for the cloture vote. I'm just curious, just your reaction to that, sir. And then what is Mitch McConnell telling you and Secretary Mnuchin?
Well, we're dealing with them all the time, and we're dealing with Mitch. We're dealing with the other side. Everybody wants to get there. We'll see what happens. I think you'll get there. To me, it's not very complicated. We have to help the worker. We have to save the companies. Because as soon as we're finished with this war, it's not a battle, it's a war. As soon as we're finished with this war, our country is going to bounce back like you've never seen before. But we have to get it to that position, and we have to make sure that those companies are whole, that they haven't been disbanded. Because if you do that, it's going to take much longer. So in a way, it's being penny wise if you don't. But we want to help the worker. We want to help the companies that the workers come from, because if those companies go out of business, and that includes small businesses, we have a tremendous amount of small business work in there, you know that. Once they go out and they don't come back, that's a much longer period of building.
You mentioned off the top, sir, I apologize. There was a woman that was an American that was she being tortured? What was going on there, sir?
Bad things were happening to her in a certain country, and we're really under the feeling that we should keep it somewhat private until she's already been freed. And I have to tell you, General Milley and his people were unbelievable. They were not playing games. General Milley does not play games. He's a very interesting guy. They got her out. They got her out of a certain country where she was seriously abused, accosted, and whatever the maximum word is, other than death, that happened. But we got her out, and she's okay, and she's back with her parents.
Can I ask you one last question, sir? It's something I've just been curious about. Previous crises like the tsunami, Katrina, past presidents, they've called their predecessors and said, hey, I need you to step in, do something like that. Do you have any interest in reaching out to Presidents Bush, Obama, Clinton, Carter, or talking to them? I'm just curious if that's something you would consider or not.
Look, I have the best people in the world. I think we're doing an extraordinary job. If you look at, let's say, the H1N1, you look at that was a disaster. That was a tough period of time for our country. You look at so many other things that weren't handled very well, whether it's Katrina or something else. Look, I respect everybody, but I feel I have an incredible team, and I think we're doing an incredible job. When you look at the job we're doing, and all you have to do is look at the approval numbers on the job we're doing, I think we're doing an incredible job. So I don't want to disturb them, bother them. I don't think I'm going to learn much. And, you know, I guess you could say that there's probably a natural inclination not to call. Now, if I felt that if I called, I'd learn something, and that would save one life. It would save one life. Okay? I would make the call in 2 minutes, but I don't see that happening. Please.
Can I ask you about the comments that a couple of your former aides have said today? Gary Cohn said, is it time to start discussing the need for a date when the economy can turn back on? Whereas Steve Bannon is saying, drop the hammer today on the virus. We're going to have to take the pain up front. We have to shut it all down.
I saw both.
I want to ask you about the tension between the economic pain we're suffering and, of course, the virus itself and the casualty and deaths from that.
Well, look, I'm of the opinion we have to do great during this 14 days, during the 15-day period. We'll know at the end of 14 days, pretty much, we're going to have a pretty good idea how we're doing. I think you have to shut it down and you have to see, but, you know, there'll be a point at which we say, we're back in business, let's go. Those two statements are not mutually exclusive. You understand? I saw both of them today.
Well, I think
and they sort of they intermesh.
For more of a shutdown
well,
than we are now.
He's calling for a faster, just a brutal shutdown, and then open up maybe a little bit faster. So, you know, there's that fine line. Look, we did a big shutdown when we wouldn't allow people from China that could have been very seriously infected, when we cut that off very early. And then we cut Europe off very early, as you know. So that was also very
When do you start opening Main Street back up?
I can't tell you that. What I have to say is that I think we're going to have good results. I think the American people have been amazing. I think our stimulus package will get done, and it will be a tremendous package. We're really not, I mean, they may not have gotten those votes, but they're very close to getting a deal done. So I'd be surprised if they didn't. And if they don't, I think, frankly, the American people will be very upset with the Democrats because the Republicans are ready to approve a deal. So the only reason a deal couldn't get done is pure politics. Yes, please.
Mr. President, despite your differences with New York City Mayor Bill de Blasio, he says that the city is going to run out of basic hospital supplies by April. How do you prevent New York City from becoming the next Italy?
Well, he should have, you know, the hospital systems in various places. Some have been stocked and ready to go for nothing for this, nothing. This is beyond anything that anybody ever thought possible. I think you could really say this. Nobody can really, doctor, nobody can really say, oh, gee, this will happen. This is a very unique, and hopefully it will be unique for, you know, many, many centuries, you know, for a long time. Hopefully we don't see this again. But again, the systems are supposed to be ready, willing, and able. They're supposed to be ready to go. We are helping them a lot, and I have great love for New York City, and I have great love for New York State, and we're going to help them a lot. I mean, I was just saying, we're sending our ships up there. We're sending more than just this ship. We may be using, if we need, we'll be using some of the cruise ships that you've been reading about. We'll be using them also because they're very immediate and very quick. They can be there very quickly. We have good docking systems in the places that we're talking about. So we may be using some of the cruise liners that we're talking about. But no, I mean, I think Bill de Blasio is working very hard. I think he's trying very hard. It's a tough situation for him and every mayor because nobody's ever seen the scale. You know, when you hear you've given millions of masks and you've given hundreds of thousands of masks in a certain short period of time, and then you hear they need many, many more. You know, one of the things they have started with respect to masks is the sterilization process. Some are really, it works very well. Others aren't really set up that way. You throw them out. But we have a sterilization process that's working very hard. Speaking of that, hand sanitizers, you know, when you asked the question on the companies and what's going on, we have many companies now, companies that made whiskey, that made alcohol. They've now gone very quickly into the hand sanitizers and all of, you know, you've been reading about 3 or 4 big companies. We're doing incredibly well on that. There was no way if you took the existing companies that something like that could happen. But it happens almost, they'll call Peter Navarro or they'll call somebody. In one case, they called me. They said, we can do this, we can do that. We've had a lot of those calls where companies want to, there's a company in New Hampshire, a great company, they want to make ventilators. I'd never thought of them for ventilators, but they do make metal equipment and things out of metal. They'll be great. They'll make a great product. So, Peter, I think you're seeing a lot of that, right?
Yes, sir.
Yes, please.
Mr. President. The bill that is being contemplated by the Senate right now has a fund that has hundreds of billions of dollars for the Treasury Department to use to bail out states and localities, as well as specific industries such as cruises and hotels. Will you commit publicly that none of that taxpayer money will go towards your own personal property?
Every time I do it, like for instance, I committed publicly that I wouldn't take the $450,000 salary. It's a lot of money, whether you're rich or not. It's a lot of money. And I did it. Nobody cared. Nobody said thank you. Nobody said thank you very much. Now, I didn't commit legally. I just said, I don't want it. I don't want my salary. I work for zero. I don't want my salary. Nobody said, oh, thank you very much. But I guarantee you, if I ever took it, you would go out after me, you in particular, would go out after me like crazy. So I have no idea what they're talking about with regard to the one element. Everything's changing, just so you understand. It's all changing. But I have no idea. But every time I commit to do something, I committed to do many. Look, I ran, and everybody knew I was a rich person. I built a great company, and people knew that. But I agreed to do things I didn't have to. I still don't have to. But my company, I told the kids who are running it, I'm not running it, but I told them, don't deal with foreign companies. Don't deal. I didn't have to do that. I could have just ran, and I didn't have to do that at all. And instead of being thanked for, again, not agreeing to do it, but just for not doing it, I get excoriated all the time. So I've learned, let's just see what happens, because we have to save some of these great companies. They can be great companies literally in a matter of weeks. We have to save them. Yeah, please.
Thank you, Mr. President. Can I go back to your announcement at the top about the National Guard and then also the medical structures that are going to be built? Okay, so you had said that there would be 8 large medical structures that will be built in California with more than 2,000 beds. And then I think I heard you say there would be 4 small medical structures in the state of Washington with 250 beds. And could you say what cities and areas those are going to be in specifically?
So we are filling the governor's request, and so we send that resource to them. They'll put it to best use. They'll put it to where they will have the most effect. So we don't dictate exactly where it goes. Again, it's a request from the state to the federal government for a certain asset, and those assets are sent to the governor can use it as he or she sees fit.
And you're still considering, you just said that using the cruise ships as well. So
if we need them, I hope we don't need them. I hope you're going to have great luck on Tuesday morning. We sent a lot of the medicine. We don't have to go into it again, but we sent a lot of the medicine to Governor Cuomo. I believe they already have it. And they have some very capable people. We spoke to Dr. Zucker, who is his primary representative on this, and we spoke to the governor himself. And I think he's excited about it like I'm excited about it. Now, will it work? I think it has a really good chance. I think it's worthwhile. Why should we be testing it in a test tube for a year and a half when we have thousands of people that are very sick? They're very, very sick. And we can use it on those people and maybe make them better, and in some cases maybe save their lives. So Governor Cuomo told me they'll be using their supply, starting their supply on Tuesday morning. I think it's very exciting. I think because if that happens, much of what we're talking about with ships and hospitals and all of the things that we're doing and all of these masks and everything that we're ordering, ventilators, it's a whole different game if that happens. And we'll see. There's been some tremendous signs that this could work. Now, again, you know, some doctors think it should go for years and testing, but, you know, this has been something that's been around for many years. It's been phenomenal, strong, powerful drug for malaria. But we think it might work on this based on evidence, based on very strong evidence. We're going to see. We're going to know on, you know, sometime after Tuesday. But you'll have to ask Governor Cuomo. I think they're going to start the process. We've gotten them the drug. I think they're going to start the process of giving the drug mouth, you know, through mouth. And I think that starts on Tuesday morning, he said. And that'll be, I mean, I tell you what, I don't want to get anybody overly excited, but I'm very excited by that, by the prospect of it. Then in addition to that, they're working NIH is working on vaccines and all. They're making great progress. But the vaccine does have to be tested for a long period of time because you can't give, thousands, millions of people a vaccine and it turns out to be dangerous. So that does have to be tested. But this one's been taken for a long time, so we know pretty much one result. Yeah, please.
Thank you, Mr. President. I wanted to ask about China and President Xi. When was the last time you had a conversation with
Well, I don't want to exactly say that, but I have spoken to President Xi about this, specifically about this. And look, he doesn't want this. This is not something that he wants. And it happened. It happened to China. And one thing they told me, I was told by our great Secretary of Agriculture, Sonny Perdue, that China's been buying a lot of our farm product. And I'm looking at different pricing. But China has, despite all of this, and it started, this delayed it a little bit, obviously, but it started fairly recently. But China's buying. We made a new deal, as you know, with China, a very big trade deal, and China has been buying our agricultural product.
Have you talked to China about masks? I mean, they've been a supplier of the United States of masks, of a lot of this equipment.
In fact, they're sending some masks. They're sending masks to Italy. They are sending masks to Italy. We're in a very good process with masks. But I'm a little upset with China, I'll be honest with you, because as much as I like President Xi and as much as I respect the country and admire the country, I have great admiration for the country, what they've done in a short period of time. Of course, our previous presidents allowed that to happen. You should say thank you very much to all of them. But they should have told us about this. And I did ask him whether or not we could send some people in. They didn't want that. Out of pride, I think really out of pride. They don't want us sending people into China to help them. China's a strong country. They have their scientists and they have their doctors, very smart, a lot of people. But I did discuss that about sending our people in. And they didn't really respond. We went again, they didn't respond. If they went in, they would have been able to give us a much earlier indication. But we had an early indication. That's why I closed out China. I mean, I felt it was my instinct, but that's why I closed out China at a very early time. Please.
Mr. President, are undocumented persons welcome at testing sites, and can they show up and be tested without fear of being reported to immigration officials for possible deportation?
It's really a fair question. I think I'll let... would you like to answer that question? Please,
Absolutely.
Please. Surgeon General?
We know from a public health perspective that it is important that people who have symptoms can get tested, but as you heard earlier, we are...
Regardless of citizenship.
Well, we know that the virus doesn't judge based on where you're from, and so it's important that we try to get people tested who have symptoms, but the important thing that we really want people to hear is that inpatients need to be tested. We need to prioritize our healthcare workers. And one thing I would like to say to you all very quickly, on behalf of the doctors on the task force, healthcare workers, we hear you. We hear you, and we absolutely are prioritizing your health and safety, making sure healthcare workers can get tested, inpatients can get tested, people at highest risk. But to answer your question, yes, we absolutely want to make sure people who have symptoms who could be spreading it can get tested.
Mr. President, sorry, question. Mr. Surgeon General.
Department of Homeland Security addressed that issue a few days ago. Customs and Border Protection actually issued guidance that absent certain circumstances, Customs and Border Protection does not target emergency rooms or health clinics. And I would refer you to the website. They issued a very clear statement making it clear to any person that is in need of a test or medical care that Customs and Border Protection is not focusing on emergency rooms or health clinics or the drive-through clinics.
So that they could come in without fear of...
Yes, I'll answer that. And if that's not the policy, I'll make it the policy. And I was just saying, as Mike was saying that, the answer is yes, we will do those tests because I think in that case it's important. I think that if you could say illegal alien, you could say illegal immigrant, you could say whatever you want to use your definition of what you're talking about. We're all talking about the same thing. Yes, we will test that person, because I think it's important that we test that person, and we don't want to send that person back into wherever we're going to be sending the person, whether it's another country or someplace else, because, you know, we're now bringing them right out of our country. But, yeah, we will test those people. Okay?
Mr. President,
Yeah,
sorry, Mr. Surgeon General, a question for we were talking about this before the briefing. You know, a lot of folks, they're watching TV, they're reading up on this constantly. If you are not, you know, somebody who's got a pre-existing health condition, but you all of a sudden you go, you know, all of a sudden I just don't feel 100%, and then your mind just starts playing with you, right? You think, oh my God, you know, I coughed 3 hours ago. Was that a first sign? When should those people really start to say, okay, maybe I need to call the doctor? Because you don't want to flood them, but a lot of people that are probably healthy right now are thinking, whoa, wait, that's all I'm hearing about. That's all I can think about. When should I either call a doctor or get tested?
You need a test?
Well, I hope not.
I asked you before you came in if they've been temperature checked.
Right? You better not.
The Vice President gave an important statistic this morning. Only 10% of the people who have symptoms who've been tested actually tested positive for coronavirus, meaning 9 out of 10 people who actually likely had symptoms do not have the coronavirus. So I want people to understand that so that they are reassured. I also want to direct people to a website we've been telling them about all the time, coronavirus.gov. Coronavirus.gov has information to walk you through the symptoms, fever, cough, shortness of breath, body aches, and what to do if you have symptoms or you're worried. The most important thing we can tell people is call your healthcare provider, talk to your healthcare provider. Information is at coronavirus.gov to walk you through when to come in and when and what to do.
And Mr. Vice President, you got tested yesterday. I'm just curious, sir. Can you tell us what that was like for you? A lot of people are going to be going through this. What were you standing by the phone? Were you just having a nice tea? I mean, what did you? Yeah, what was that like? And what did you do to kind of kill that time to keep your mind at ease?
He wasn't.
The test was very quick, but it goes a fair amount up into your sinuses, and it's not comfortable. And that's the reason it probably is a good opportunity to say again to any American looking on. If you don't have symptoms, you don't need a test. The current testing format, although they're evolving regularly now, we just mentioned that we think at the end of this week there'll be a new test, and there's all new technologies. I would say again to all the governors that are looking on and their state health officials, contact FEMA. We'll give you all the latest information on new testing that is available, including steps we're making where Americans would be able to test themselves and send it in.
For you, what was that like for you, sir?
Well, for me and Mrs. Pence, it was kind of a pinch. It was kind of invasive, but we were grateful for the support. Walter Reed Hospital processed the test very quickly. They had a lab at the hospital to be able to do that, and gave us the results quickly. But it also informed me. We were wondering during that time as a family, and it's one of the reasons the President's made it such a priority that we brought all these commercial labs together. And now more than 250,000 tests have been done. We believe we'll be caught up, if you will, by the middle of this week on a backlog of tests. But we announced today that we are directing commercial labs to prioritize people who are in the hospital for tests, as we want to continue to work with new technology and with the new focus and guidance from HHS to get the results of that as quickly as possible for every American. So if they have coronavirus, they can be properly treated, or they can have the peace of mind that they may have some other respiratory ailment, but not that.
Mr. President. And you know, anybody that knows Karen Pence knows this, because the Vice President told me. He said she actually handled it better than him. Right? That's true, right? I didn't handle it so well either. Don't worry about it.
President, Speaker Pelosi earlier today said that the House may introduce its own bill. A, are you willing to work with the Speaker on a House bill? And given what happened in the Senate just a short time ago, what are you willing to do to get this bill over the finish line, given the urgency? Secondly, did you send a letter to North Korea's Kim Jong-un seeking cooperation with the coronavirus? And if so, what type of...
With numerous countries. If they need help, we'll give them help. There's nobody has what we have, especially with the new tests that are coming out. North Korea, Iran, by the way, and others. We are open for helping other countries. and there's a very serious time, and North Korea is going through something. Iran is going through something very, very strong. Iran is really going through a very difficult period with respect to this, as you know. So I've put the it's really a glad hand, it's all it is, to North Korea, to Iran, and to many other countries. And we're working with, as the doctor can say, we're working with many countries with respect to the problems that they have. Again, it's over 140 countries right now. But North Korea, Iran, and many other countries, we will help, and we're willing to. As an example, this new test, if this new test works out, where instead of going through what we all went through with this rather difficult test, to put it nicely, we would have, is that just a swab on the tongue, doctor? Or how does that work?
It's a similar swab, but they can work in doing it in the nose.
Not to the same. Not to the same.
All the way
It doesn't go all the way up and hangs right under your eye, right? So that's a tough test. So if we do that, the procedure, the test, and nobody has this in the world. Nobody has this. This is developed by us. We think it's going to be certified soon. We think it's going to be very good. But if we have that, we'll be able to help a lot of countries.
And
Please.
what about Speaker Pelosi, sir? What about Speaker Pelosi?
We're going to work with everybody to see if we can get something done. Please.
I mean, just to follow up on that, are you willing to work directly with Speaker Pelosi?
Yeah, we'll work with whoever we have to. We have to help the American worker. We have to help the countries from which the American workers, I mean, they came out of these companies, they were doing phenomenally well. You saw where payroll was going way up, where wages were going way, way up. There's never been a time like this. We can't lose those companies, and we want the worker to be happy. And we're being, I think, more generous than anybody's ever been. We want to take care of the worker, but we want to make sure that when we win the war, it's only a question of, it's when, not if. When we win the war against the virus, we want to make sure those companies are ready to charge forward. Not that they've been disbanded because we were penny wise and dollar foolish.
Mr. President, there are factories around the world that produce medical protective equipment that are used in European hospitals. They've been certified for use at the highest level in European hospitals. Is the FDA and your administration willing to look at a waiver for that equipment to be sold from those factories?
Well, we were asked that question a little while ago, and the answer is we may, but we may not need it. We do a very high standard. Our standard is higher. Please.
Thank you, Mr. President. I was hoping you could give some guidance to American families who are anxious about their financial futures. Earlier today, on one of the Sunday morning shows, the Secretary of the Treasury, Steve Mnuchin, was talking about the millions of Americans who are impacted by these shutdowns that are happening in cities and sometimes full states.
Yeah.
And Secretary Mnuchin said that this shutdown, this lockdown, could last 10 to 12 weeks, perhaps early into June. Given that, would you consider another fiscal stimulus, another check to these families?
We're going to see what happens. Hopefully we won't need it, but we might. But we're going to see what happens. Look, the greatest thing we can do is win the war. The war is against the virus. That's the war. We do that, everything, I really believe everything's going to fall into place. It's going to be beautiful. I call it a pent-up demand. People are dying to go out to a restaurant. People are dying to go onto airplanes. I think there's a tremendous pent-up demand. You may be surprised to the degree. I think it's going to go very rapidly because this wasn't a financial crisis, just the opposite. This was a medical crisis.
Did you sell stocks, Mr. President? Did you or your family sell stocks?
No, I don't have stock. I own things that...
Did you make any alternates to investments in advance of this?
No, I didn't even think about it. You know, it's very interesting that you ask a question like that. You know, nasty question, and yet it deserves to be asked, I guess. What I've done by deciding to run, I knew this the first day. I said, if I win, it's going to cost a lot of money. It cost me billions of dollars to become president, to be president of the United States. In things that would normally be run at a certain thing, even people that don't like me because they think I'm too tough on the border. Now, some people love me for it. Other people don't like me at all. You know, it's very funny. My wife, we were at a charity event in New York City. I had just announced that I was running, and we were at the Robin Hood Foundation at the convention center, which now we're going to be converting to hospitals for Governor Cuomo. Right? And I was walking in, and there was a smattering of boos and a smattering of cheers. I was getting both. And our very popular First Lady, she's turned out to be very popular. People have great respect for her. But a very popular first lady said to me, that's strange. I've never heard anybody booing you. That was very early on, because I think I called for strong borders, or I called for something that other people don't like, And I knew this would happen. I knew it was going to happen. But the fact that I ran, and I knew as soon as I announced, when I ran, I said, it's going to cost me a fortune, not only in terms of actual costs. Look at my legal costs. You people, everybody is suing me. I'm being sued by people that I never even heard of. I'm being sued all over the place and doing very well, but it's unfair. But I'll say this, in terms of running for president, and I don't think rich people, Michael Bloomberg spent now is determined almost $1 billion, and look what happened. I think it's very hard for rich people to run for office. It's far more costly. It's just it's a very tough thing. Now, with all of that being said, I'm so glad I've done it because, there are a lot of rich people around, got a lot of rich friends, but they can't help and they can't do what I've done in terms of helping this country. We are doing things. We got sidetracked by the invisible enemy, but, when you look at what we've done, I said before, with the veterans, with all of the things we've done, especially choice, but when you look at all of accountability, when you look at all of the things that we've done, rebuilding the military, the tax cuts, which thank goodness we had the tax cuts because we had cushion. Without that, this would have been catastrophic. We had a big cushion. I mean, with all of the losses that you've seen in the stock market, we're basically back, and with this horrible thing, if this would have happened before, you would have had nothing left. This was all cushion. But I will say that it cost me billions of dollars to be president, and especially with all the money I could have made for the last 3-4 years, and I didn't because I was being president. I have no interest in it. I'm allowed to. I don't know if you know, George Washington, they say, he was a rich man, supposedly, relatively rich. And he ran the presidency, and he also ran his business. They say he had 2 desks. Nobody complained until I came along. I got elected as a rich person, but nobody complained until I came along. So it cost me billions of dollars to be president, and I am so happy I did it. Because who cares? Who cares? I'm really happy with the job we're doing, and I'm glad that this team and me are here for this horrible thing. I mean, it's a number of people have said it, and I feel it, actually. I'm a wartime president. This is a war. This is a war, different kind of a war than we've ever had. And when you look at the economics of the war, in the past we used to stimulate to get people jobs. Now we're stimulating to protect people because we don't want them to work, because we want them to stay away from each other. We don't want them to gather, social gathering. So we're paying billions of dollars more than that so that they don't gather. Because we have to defeat this virus, and we will. But it cost me billions and billions of dollars to be president, and I am so happy I did it.
Foreign countries, please. I realize that your priority is to Americans and, of course, this nation. But what about, have you ever considered supporting the foreign countries who are also fighting this global pandemic?
We do help foreign countries. I mean, that was the other question.
Right.
And I'm honored to help. And the doctor has helped. The Surgeon General is speaking to other countries all the time. They're asking him questions. What do we do? Nobody's ever seen anything like this. They're calling our people all of the time. And yes, I have let it be known that we'll help people, including North Korea, including Iran, and including many other countries. It's very important to do that.
Are you considering any financial support for them? Let me quote to you two retired, a retired general and a retired admiral from the U.S. Global Coalition. No matter how successful we are in fighting the threat of COVID-19 pandemic at home, we'll never stop it unless we're also fighting it around the world. So financially, is there anything in the stimulus bill? And then are you considering any financial
No, not in the stimulus bill, but we are very much, I mean, we give away billions of dollars for, as an example, AIDS in Africa. We're still fighting that battle. It's a tremendous battle, tremendous war also. But we're fighting it here, as you know, in 10 years. Now it's 8 years because I started it. It should have been started before, long before I got here, because they had the answer even before. But we're fighting that battle. We'll be AIDS-free in approximately 8 years. It looks like that is going to happen. We're spending a lot of money, but we're spending a lot of money with other countries. If you look at the aid that we give to other countries, we give billions and billions and billions of dollars to other countries. And a lot of times I say, we could save a lot of money. We shouldn't. And then they come in. I say, what's it used for? It's used to fight malaria. It's in countries that are very poor. It's used to fight AIDS in Africa. It's used to fight many other things. And I don't think I've ever said no. I can't. It's just so terrible. Countries that we have really, we're not involved with them very much, other than there would be tremendous death. Tremendous death. I mean, you can get a list, and I could get you a list. We give away billions of dollars to other countries, and we are giving away a lot in terms of everything, and probably we'll end up economically doing something for other countries. But when I'm presented with these lists, that yes, sir, in Africa we're fighting AIDS or we're fighting something else, I tell you what, I start off by saying, we could save a lot of money. And then by the time they walk those lists into my office, I say, we have to keep doing that. That's humanity you're talking. How about one more question? Yes, please.
Sure, thank you. I wanted to ask you about the states that have not yet issued stay-at-home orders. So in Texas, for example, the hospitals have said that they expect to run out of beds by the end of April if the governor does not issue a stay-at-home order. Dallas County just announced an order. It's not uniform.
States have to call. That's a great governor. You're talking about Greg Abbott in Texas, and he's a great governor, and he knows what he's doing. A lot of the areas that he's talking about, a lot of the counties he's talking about are not very strongly affected. It's a very different kind of a place and a great place. But I have total confidence in Governor Greg Abbott.
So you're okay with the lack of uniformity between
Yeah, sure,
states?
because every state is different. Every state's different. I mean, Idaho, West Virginia, Iowa, Nebraska are much different than New York, than California, Los Angeles as an example, or San Francisco. They're much different. I mean, it's much different. The hot spots right now are state of Washington, and probably number one by far right now is New York. That's the hot spot like no other hot spot. And California is a hot spot, but New York right now is the leader. There's no question. All right, final question.
Thank you, sir. Your administration is backing a lawsuit to invalidate the Affordable Care Act. Given that people are losing their jobs now and need health care more than ever, would you consider rethinking your position on that?
Well, that's a lawsuit coming out of Texas again. That was headed up by Texas. And what we want to do is get rid of the bad health care and put in a great health care. And we will always, I will say this, I can make this commitment to you, the Republican Party is fully backing pre-existing conditions. Now, if we could get a great health care plan, which would need the House to do, but if we can get a great health care plan, we will only do it if we have pre-existing conditions totally back. So we're backing pre-existing, but would like to get rid of bad health care. Now, we are running the bad health care much better than it was ever run, and we're making it better. But it could be much better than it is. And so what we want to do is terminate it, have a great health care, but we will only do it with pre-existing. We will back pre-existing conditions. Okay?
But what if the Supreme
Thank you all very much. Thank you. We'll be back. We'll have a meeting tomorrow.
Thank you. Mario Diaz-Balart, not Jose, if you wanted to clarify that. You had said Jose. Works for us.
Mario.
Yes.
Oh, did it take Jose? I watched Jose on NBC.
Thank you, sir.
The other night.
Yeah.
Okay?
Thank you, Mario.
Donate blood. Donate blood. We need it.
Was President Trump. Was President Trump wrapping up a very long news conference at the White House? Says there will be another one tomorrow. What we will do now is show you all of the events that happened earlier today from across the country as states and cities all doing their briefings, and then we will see you back out live right here on coronavirusnow.com starting at 10 a.m. Eastern tomorrow, everyone. This will continue on.
Approximately 47 Pennsylvanians have required hospitalization since March 6th, when we confirmed our first cases. That continues to be approximately 10%. To date, 4,964 patients have tested negative to COVID-19. I know that this is a difficult and stressful time for everyone. It's so important for everyone to follow the direction of Governor Wolf to please stay home, and for businesses to please close, and for everyone to do their part. I know that Pennsylvanians are strong and resilient, and that our community will get through this if we all work together. Now, here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water is not available. Cover any coughs or sneezes with your elbows and not with your hands. And try not to touch your face, especially after touching a surface. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your healthcare provider. If you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is please stay calm, stay home, and stay safe. And now I'm pleased to answer any questions.
Thank you, Secretary. From KDKA, will we reach a time during this epidemic where we have enough tests for everyone to get tested, whether they meet the criteria or not?
So, through many different methods, we have wide-range testing now. We can do tests through the Pennsylvania Department of Health, and we are prioritizing those tests for healthcare workers, for potential clusters or outbreaks, and so we can do those tests. In addition, more and more health systems and hospitals are doing tests. And in addition, healthcare providers can order tests through LabCorp and Quest, those commercial providers. In addition, in the Southeast, there continue to be mass testing sites in Philadelphia and in Montgomery County, and those are open daily. We do not want to test individuals that have no symptoms. It's not necessary, and those tests are not clinically meaningful to us because you could get exposed the next day, or you could be in that incubation period where a test would be negative. So I don't see a time that we'll be testing asymptomatic people, certainly in the foreseeable future.
And then as a follow-up to that question, there have been moments where the local and state numbers in terms of case counts don't match. KDKA would like to know, can we continue to improve communication to make sure that we're all on the same page? Can you describe how the case count works?
Sure. So at the Pennsylvania Department of Health, the numbers that we are releasing, we are pulling together at 12 noon and then doing our daily press release. And so other county and municipal health departments might be collecting and releasing their data at a different time of day or on an ongoing basis. So there might be a discrepancy for a short period of time. We are going to continue to release our results, which we collect from throughout the state. Again, we collect results from our laboratory, hospital and health system laboratories, from LabCorp, Quest, et cetera, at 12 noon each day, and we will release the results at that time.
And then from WGAL, do we have information on the locations of clusters of cases within each county? And are we considering shutting down takeout and delivery options for restaurants at this time?
So there are no plans to shut down takeout and delivery. We do have to make sure that people get food. Not everyone can prepare food at their home, and so takeout and delivery can be very essential for certain people. And so that would be considered a life-sustaining business in terms of the business criteria at this time.
From the morning call,